Good morning, everybody. The meeting is now called to order at 9:05. We will now have a moment of silence, silent reflection, or silent prayer. I'd like to especially thank all of the frontline healthcare and pre-hospital workers throughout our county, as well as all of our San Joaquin County personnel who are still on the job during these really difficult times. Thank you. Supervisor Villapudua, will you lead us in the pledge?
Yes, please, yeah.
I pledge allegiance to the flag of the United States of America, the republic for which it stands, one nation under God.
Thank you. For the record, this is the San Joaquin County Board of Supervisors meeting of Tuesday, March 24th, 2020. Will the clerk please call the roll?
Supervisor Villapudua?
Present.
Supervisor Patty?
Yes.
Supervisor Nguyen?
Here.
Supervisor Elliott?
Here.
And Madam Chair Miller?
Yes, here. Thank you. We're going to begin with some recognition and presentations. Because we are not having any public participation in the chambers, each of these recipients have been informed that they will receive their plaques in the mail. And in one case, we actually received a response. So I'm going to turn to the clerk of the board and ask you to please read the recommendation and the response.
So the first recognition today is of retiring Probation Officer Stephanie James. Ms. James has 25 years of service with the Probation Department. She was hired as Probation Officer 1, promoting through the ranks of Probation Unit Supervisor, Assistant Deputy Chief Probation Officer, Deputy Chief Probation Officer, Assistant County Probation Officer, and finally County Probation Officer in July of 2012. Ms. James is an active member of the Chief Probation Officers of California and serves as a member of the Research Committee, the Training Committee, and the Awards Committee. Ms. James has been awarded the Outstanding Professional in Law Enforcement Award and the Don L. Asher Memorial Day Award. And Ms. James writes, and she states, she would like to thank the Board of Supervisors for their support. It has been a great honor and privilege to have led the San Joaquin County Probation Department for the past 8 years. She would like to acknowledge the great men and women of the Probation Department for their hard work and tireless dedication to serving her clients, the courts, and our community. With these uncertain times, she prays that everyone stays safe and healthy and thanks the Board of Supervisors for this recognition.
Thank you. Would any supervisors like to make a few comments? Supervisor Villapudua?
Yes, sure. Chief James watching, I know, just want to thank her for 8 years of service as our chief and always being there for our county and working really hard and set a great example. And she has a great story. I know she started out as a volunteer. So I'm really proud of her. Thank you.
Supervisor Patty?
Thank you, Madam Chair. I've had the pleasure of serving on a board with Chief James, and the example she established in our local leadership as well as in the state was exemplary. Her department and the collaborative courts and working together in a manner that set a standard that's studied and looked to be replicated. How progressive and how efficient and how effective she had run her department and working in collaboration with many stakeholders. So you'll be sorely missed, Chief James, and enjoy your retirement. It's well deserved, but we sure wish to see you again. So thank you.
Supervisor Nguyen?
Thank you, Madam Chair. I had the opportunity before I came on the board to be the director of a criminal justice system in a local college, and as part of that responsibility, we had to have an advisory committee made up of law enforcement officials, and Chief James was a part of that, Sheriff Moore. And the reason I bring that up is because it was critical to our curriculum and certainly our students in regards to getting input from the professionals, and certainly in regards to preparation and testing and the process itself. And then since then, obviously being on the board and dealing with her on a variety of issues, I've always been impressed by her leadership, and as Supervisor Patty said, not just locally but statewide and probably nationally. She has been an innovator. She's been a leader in regards to implementing new and innovative technologies and procedures. And she will be sorely missed, but we wish her the best in regards to her retirement. Thank you.
Supervisor Elliott.
Thank you. Yes, I'd certainly like to extend my thanks as well to all of the great things that Chief James has done. She's been a leader in terms of many of the developments that have occurred over the past many years, leading us through the realignment process, which changed in a major way. Some of the law enforcement and probation functions occurred. She was always a proponent for very common sense, evidence-based initiatives. And I think that served us well, and that's why we were looked at as a leader in terms of coming up with new ways to cope with the new realities that were there. So we'll certainly miss all of the things that she's done, but we wish her the very best in her retirement.
Thank you. I'm going to echo my colleagues. When AB 109 first came down, there was almost a panic level throughout governments in the state. How would this be implemented? How on earth were we going to be able to meet these incredibly different protocols? And Chief James was really instrumental in diving in. Instead of digging in her heels and trying to fight it, Chief James embraced the reforms, and she really led the way. And her role at the statewide level was really instrumental in helping other counties figure out how this could work and be effective. The numbers in San Joaquin County in terms of reducing recidivism have been impressive, to say the least. And a big part of that is because of Chief James's leadership. The Community Corrections Partnership, the collaboration that occurs there with all of the different members, it's really great to see if you attend any of those meetings. It's a very much a partnership with all of the agencies, with the goal of making sure that our residents who have, for one reason or another, become involved in the criminal justice system find a new pathway to becoming productive citizens and returning to their neighborhoods and to life in our county. So Chief James really led the way on this, and I'm very grateful. I think all of us are, and we really wish her all the best in a well-deserved retirement, and I'm quite sure her family is going to be very pleased to be seeing more of her. So best of everything to Chief James. Thank you. Clerk, number 2.
The next recognition is of retiring Interim Environmental Health Director Casey Foley. Ms. Foley has over 32 years of experience with environmental health, hired as sanitarian trainee in December 1987. Ms. Foley trained in all 28 environmental health programs, becoming registered with the state of California as registered environmental health specialist. Her focus was with underground storage tank, hazardous waste, and emergency response programs, which became known as the Certified Unified Program Agency, or CUPA. Ms. Foley represented the county as the CUPA Forum Board Member, Executive Board Member, and won Outstanding CUPA Program Manager for the State of California in 2016. Ms. Foley served as Environmental Health Assistant Director for 3 years, and for the past 6 months has served as the Interim Director. And Ms. Foley, here for morning.
Thank you. Board.
Again, we appreciate all the great work that the interim director Foley did during her time here, not only before she became interim director, but also in the transitional period while she was the interim director. being Director of Environmental Health is never an easy job, but she certainly stepped up to the challenge and did a great job. So we appreciate all of her efforts, and again, we wish her the very best in her retirement.
Supervisor Wynn.
Thank you, Madam Chair. I can't think of a more difficult, challenging job, and one that is probably most criticized in county government. I would have to say I appreciate everyone in environmental health. Certainly, Ms. Foley, in regards to her assistant director position, interim director position, has continued to lead the way in regards to accomplishing this very difficult task. And so I thank her for her service and certainly for her dedication and the service and the benefit she's provided to the county residents, but also wish her the very best in her retirement. Thank you.
Supervisor Patty.
Thank you, Madam Chair. As already noted, it's a very difficult job and position, oftentimes thankless, and one of the more challenging with all the state and federal and mandatory regulations that come down. So I know that our interim director was diligent, worked hard, used her experience, and was dedicated to San Joaquin County and in service. We thank and appreciate that, and wish you the very best in your retirement.
Yeah,
Supervisor
Keith,
Villapudua.
thank you, Madam Chair. Keith, I just wanted to say, I hope you enjoy your retirement. You've done a great job for our county the last few years, and thank you for always working with me and taking my phone calls and putting up with all our problems. It's a tough job, and hope you have the best retirement. Thank you.
And I'm going to echo once again our gratitude for your many, many years of service, the way you applied yourself to developing expertise in areas that were really needed in San Joaquin County. And again, we understand this is really a hard job, and you come under fire really almost from all directions, and it's difficult, but we appreciate your service, and we hope you have really a wonderful retirement. Thank you. Okay, now we're going to move on to public comment. I'm going to read this because public comment's a little different these days. Public comments limited to 250 words or less may be submitted by sending an email to cobrecords@sjgov.org. Please, no personal attacks. Every effort will be made to read all comments received into the record, but some comments may not be read due to time limitations. They may be received too late, in which case they will still be entered into the record. They will be part of the official file on record with the clerk of the board if they're received prior to the end of the meeting. Comments made on YouTube, however, are not considered part of the official record and will not be shared with the board. If you need disability-related modification or accommodation in order to participate in this meeting, we ask that you please contact the clerk of the board at 209-468-2350 at least 48 hours prior to the start of the meeting. So I'm going to turn to the clerk. I believe we have received some public comment, so let's go ahead and hear those, please.
Okay. Our first public comment is from Sharon Covello. She says, thank you for taking the time to read this email. These are difficult and trying times, unlike any other most of us have had to endure. Throughout the country, local governments and employers are stepping up and taking a progressive approach to the current health crisis our country is facing. This cannot be said for the county of San Joaquin. Employees are fearful of staying home, fearful of management's reaction and retaliation. Some are coming to work sick, potentially exposing coworkers and the public we serve. Others are caring for sick family members while coming to work and again potentially exposing others. And there are still others that have high-risk family members in their home. The mere act of showing up to work every day and the possibility of contact with COVID-19 could result in a death sentence for their loved one. As you are aware, San Joaquin County COVID-19 statistics are grossly underreported, as the vast majority of ill persons are not even tested, therefore cannot be included in the confirmed numbers. As an employer, San Joaquin has an ethical responsibility to their workforce and their constituents to take a more aggressive stance in protecting their employees and the public we serve. The next public comment is from Mike Holmes. Members of the Board of Supervisors, I cannot express my absolute frustration as to how you and your colleagues have handled this health crisis. You have put my health and the health of my family members at extreme risk. You have allowed Ms. Nino's vendetta against SEIU members to cloud your judgment and have clearly demonstrated that our lives don't matter. Your actions have put all county employees in danger. Your Director of Public Health's recommendation at your last meeting was absolutely absurd to think the danger to the public was minimal. To think we were not on the same course as Santa Clara County has proven to be totally incorrect. The directives that were put out called for social distancing of 6 feet or more. I am currently employed by San Joaquin County Department of Child Support Services. Up until the middle of last week, we were forced to assess our workstations via elevators that were packed too full to capacity. Do you know how frightening it is to be in such close proximity during this health crisis? It wasn't until 4:20 p.m. on 3/18/2020 before we were allowed to utilize the emergency staircase to exit the building. It's time for this board to follow the lead of our surrounding counties. I respectfully request that you send any non-essential employees home and place them on administrative pay. Wherever possible, please allow as many essential employees to work from home. I also request that you terminate Ms. Nino, as she has clearly demonstrated negligent judgment on her handling of this crisis. Sincerely, Michael J. Holmes. The next comment is from Serena V. Reyes. Members of the board, my name is Serena Reyes. I work for the Department of Child Support Services. Yesterday, we were told that non-essential staff would be instructed to go home and shelter in place. My question to you is, will these employees be at risk of loosening their health care coverage if they do not have enough hours on the books to cover the 40 hours required to maintain coverage? Sincerely, Serena Reyes. The next comment is from Bill Patron, Regional Director of SEIU 1021. SEIU Local 1021, on behalf of its members, have made numerous attempts to get information and to engage the county in regards to the COVID-19 emergency. The county has made zero effort to engage. The union is hearing from the employees every day of unsafe conditions in the work sites, no practicing of social distancing, lack of protective masks and gloves, and question the sanitary conditions that a majority of your employees are working under. When we negotiate with the county, we are told we are replaceable, but when an emergency or crisis rears its head, we are suddenly essential. Treat us like we are essential. Treat us like we matter. The union has proposed a COVID-related sick leave bank separate from the employees' normal accruals. The union has asked for employees to be able to work from home to address child care needs because the schools have closed, among some other safety measures, none of which have been responded to by the county. Look around at what the superior courts have done to protect their employees. Look to Alameda and Contra Costa counties, how they value their employees, and then look in the mirror at how you have failed your employees. Signed, Bill Patron. The next comment is from MIZICKS and says, to Tom Patty, if we are disaster relief employees, that means you're a disaster relief employer. How have you prepared for this disaster? How many employees are able to work from home to keep the pandemic from spreading? The next comment is from Linda Laval. I've worked for the county for over 40 years. We have a serious epidemic and it appears that does not matter. People are dying all over this world, and we are told that we are essential. What does that mean? People's lives should matter more. I understand that customer service is important, but our lives should be just as important. This virus is airborne and is spreading faster than what is expected. Families should not be asked to risk the country, should not be at risk because the country refuses to consider allowing their worker to be home safe. This is a very sad and selfish act. The next comment is from Scott Darney. San Joaquin County should follow the examples of Alameda and Sacramento County and pay their employees if they decided to furlough them. Even partial pay would be better than leaving them in the wind. The next comment is from Gina Castellano. Dear Board, I understand that we are in challenging times right now, but the Board must act swiftly in leadership on behalf of the community's safety. I ask that the board recognize that in-home health care providers are essential workers and provide masks and gloves immediately to avoid the spread of the coronavirus. Thank you. The next comment is from Miguel. It says, "Good morning, board members. My name is Miguel Aguirre. I live in Weston Ranch, and I am an engineer in the Public Works Department. I urge the county to settle our contracts. In the CAO's budget presentation 2 weeks ago, one of the final slides mentioned, quote, uncertainty of total cost impacts of outstanding labor agreements remain a major concern, end quote. This uncertainty can be eliminated if the county imposes their best and final offer, or if the county chooses, impose a dull offer. Concurrence is not required. Another bullet point that is mentioned in the same slide was, quote, current county proposal to SEIU in first 12 months is approximately $14.9 million, in parentheses, 3.7 million NCC, in parentheses. I was shocked to hear one of the supervisors ask what NCC stands for. This is a critical point in SEIU's rebuttals. Most of the cost increases are covered by state and federal funds. After several months of bargaining and several more stalled meetings, I am alarmed that these kinds of questions are asked. I urge the county to resolve our contracts. It is important to have accurate information when making tough decisions." The next comment is from Aaron McDonald. I would ask that the board follow the example set by Alameda County and keep county employees on paid status during this time if they are not able to work at their job. If they are working while others are at home, give them the admin leave hour for hour like Alameda County is doing. Lead by example like Alameda County. The next comment is from Tommy Thurston. Dear San Joaquin County Board of Supervisors, as all county employees are defined as disaster workers and may be called back to work at any time, will those considered non-essential and told not to report to work during this mandatory stay-at-home period continue to be compensated their full wages by the county without interruption? It is clear that this is a measure to ensure the safety of the employees. Under ordinary circumstances, these employees would be reporting to work if they were not being required to stay at home by the government they serve. Additionally, each of these employees have regularly scheduled hours and normally cannot be compensated for absences that have not been approved by their supervisors. Will all of these employees be compensated for their regularly scheduled hours by the county without interruption during this mandatory stay-at-home period? I appreciate your consideration and response. The next comment is from Vicki Escalante. Good morning, distinguished San Joaquin County Board of Supervisors. My fellow members and I have had a very long battle for more than a year and a half, and that is too long. We have had a very hard and long struggle trying to achieve what we feel our members deserve as a living wage and better benefits. However, our struggle has not ended. Each time our contract goes to the negotiation table, it is more difficult than the last. Not only does this have to have an effect on our members, but on our recipients and the entire community as well. Perhaps in the best interest of all parties concerned, future negotiations regarding contracts could be litigated by a committee prior to expiration to limit any disruptions by both parties. We hope that with our next negotiation, you will find compassion and understanding of how it really is to walk a day in our shoes. Respectfully, Vicki Escalante, SEIU 2015. And that concludes the public comments that I've received.
Thank you. And I believe most, if not all, of these issues will probably be discussed during our discussion item regarding the emergency declaration. So next, I'm going to move on to consent. We made the agreement we were not going to pull items so that we would not require staff to be present, but I would like to ask the board if there are any items on consent that you would like to highlight, any information you received from asking your questions of staff, or any items that you feel you'd like to highlight for the public. If not, then I will entertain a motion to approve consent.
Make a motion to approve.
So, second.
We have a motion and a second. Please cast your votes. And the consent calendar is approved 5-0. Thank you. Okay, next, I'd like to announce that the board will be acting as the joint Board of Supervisors and Governing Board of the In-Home Supportive Services Public Authority. So I will now convene the In-Home Supportive Services Public Authority meeting. County Administrator, are you going to provide an oversight on this, or have someone else? Perhaps Brandy?
No, Madam Chair, it's a consent item,
Okay.
but we have no problem making a presentation. We have Mr. McHugh in the, I believe, in the department room, and let's go ahead and have him come out.
Just very briefly, and I want to thank everyone involved in this effort. This was a long negotiation. There were a lot of issues to work through on both sides, both SEIU 2015, their negotiating team, their members, as well as our negotiating team. I just really want to thank everyone for their efforts in reaching this agreement. This was a much needed contract, especially for these workers, and what we're going through right now only highlights the importance of the work that our IHSS workers are doing.
Thank you, Madam Chair. Mr. Hyde was our chief negotiator. I'm going to go ahead and present it. I don't see that he's coming in, so.
Very briefly, just so the public has some context on this.
Definitely. So this is for our in-home supportive services workers. This is a program. We have a public authority that is part of the county, but also functions as our board is currently sitting as the public authority board on behalf of our public authority. It's separate as your role as the Board of Supervisors. These are workers that we have roughly over 7,000 workers. Come on up, George. And you correct anything that I say incorrectly, please. I'll hit the highlights. Over 7,000 workers, roughly over, is it 600,000 hours?
Just about 7.8 million hours a year.
7.8 million hours that is allocated to these roughly 7,000 workers that essentially go into folks' homes. Also, as this board is aware, roughly 70+% of these workers are often family members of the folks that they're taking care of. This has been a growing population, but this has been a mandated program from the state of California, and the whole benefit of it from a capacity perspective, it allows health care services into our individual homes within our community. That is a less costly endeavor than placing them in a public facility or a private facility, so that the dollars can essentially be spread further within our community. Mr. McHugh, why don't you go ahead and take it from there?
Sure. Monica was pretty much exactly on the figures. The main issue with the program is keeping people safe and in their homes. One of the other services the public authority performs is a registry service for those that don't have family members taking care of them. We refer out providers that we've put through background checks and we've trained so that they can go out and get interviewed and possibly hired by folks. Right now we have about 320 providers with some availability on that registry list, so we're hoping that's enough to help with anybody that has to stop working because they're sick. We are trying to get word out that in-home supportive services providers are essential workers, and we need them to go to work as long as they're well and their recipient as well. So I wanted to take this opportunity to mention that.
Mr. McHugh, so they will continue to be reimbursed for their hours?
There's the state filed for a waiver with the federal government, so this is a Medicaid waiver program, to be able to enroll people in payroll without doing the fingerprinting or in-person orientations. As of last week, we canceled all orientations. We will collect paperwork online in getting ready for that waiver approval to come through. We're also exploring a online orientation option that's a relatively low cost and may be able, if we can't get that waiver, it may help us. Really need the waiver because most of the locations that provide live scan fingerprinting services are closed down right now. Right. There's, I think, 2 or 3 in the county that are still operating. But for now, we aren't able to get anybody into payroll unless their background check has already been done. And as of Friday, because we're not doing orientations, we're going to have to hold on to those payroll enrollments. But we're going to do everything we can to get them paid. The state is working hard and giving us support.
But the folks that are already part of the program, we're encouraging them to go ahead and use
go ahead and work.
We did have one question from public comment from an IHSS worker concerning supplies, training and supplies to help keep them healthy during the COVID-19 situation. How are these employees accessing those supplies, and is there online training available that's specific to COVID-19?
I don't know of any online training, but I am looking for some, and we have a website and a Facebook page, and I also have probably about 1,200 people a week go through our Google page, so we do get some announcements out there. We will look for something we can put like on YouTube or link to things on YouTube. Currently, we have the orientation online, so the providers are new. They're going to be able to watch that to get at least an understanding of how to keep track of their hours and how to fill out timesheets once they get them. So we have that online in English and Spanish and Chinese. For protective equipment, there's a increase in this MOU, but our funds ran out earlier in the year, so we currently don't have any equipment. If the state approves this rate application, we expect that we'll be able to spend the additional money, it's about $2,200 additional on protective equipment if we can get it in June. But they are essentially on their own for as far as tracking down protective equipment at this time. They don't plug into the systems that are supplying the hospitals, which are obviously the medical facilities. Obviously, going to be an EMS. Obviously, going to be a higher priority. But Monica mentioned it's about 70% family, and it's gone up to about 75% in the last few months. It does fluctuate, so that's not unusual. About 2,000 people are live-in providers, so whether they're related or not, they're actually living in the home. So the need and benefit of protective equipment is a little less urgent if you're with somebody you're living with. Really only about 2,400 people, I'd say, that are going in and out of homes. And a fair number of people take care of more than one recipient. So that is a concern, and just trying to get the word out to remind people to wash their hands and frequently when they're working and in between homes, going in between the homes.
Madam Chair, board members, you're going to hear later on in today's presentation about the phenomenal generosity and the timeliness that both our CEO of our hospital has reached out to a private provider of PPE equipment, along with our EMS director, Mr. Birch, to be in line to receive resources from the state of California. So we will do what we can to at least provide Mr. McHugh and his employees and see what we can do to make it available through our county IHSS, whatever we can get our hands on. I just can't guarantee it, but there's been phenomenal generosity and thoughtfulness of both private and public entities coming together, because there is definitely a shortage. But thank you, George, for letting me know that, because I'll start making a few calls after today's board meeting, and hopefully a few folks can hear me so that we can get access to some of this equipment. But if I can, did you have any more to say? I was going to bring up a few of the positive highlights of this agreement.
You go ahead. If you
Okay. So, as this board has been well aware and well briefed on, currently our IHSS workers are currently at the minimum wage of $13 an hour. How this additional 50 cents works, and this goes into effect, the pay, let me just look at this real quickly. Upon the board's approval, this increase goes into effect. And this 50 cents, and this board's aware, our minimum wage continues to go up until January of 2022, when it tops out at $15 an hour. This additional 50 cents will continue to float on top of the minimum wage. So even though it'll now be $13.50 upon positive ratification of this board's action today, that 50 cents will get added every time there's an increase in the state's minimum wage requirements. So I want to make sure both the public and our audience knows how this increase, which is extremely positive. This is for a 36-month agreement, and I want to make sure upon ratification of this board's action will be 36 months when this contract will come up again.
That's great. Thank you. I want to highlight, this is clearly a gap that we've identified, and I think we need to make sure that we do everything possible that we do get supplies to these workers. There's a tremendous infection risk here, and as they circulate among other homes, the opportunity to spread this just goes up exponentially. And I don't think just saying that because they're in the home with someone, they're dealing with a very at-risk population. I don't think it's fair to say that just because it's a family member, they shouldn't get protective equipment. And if there are budget issues that this board needs to deal with down the road to make sure that our workers are as safe as we can make them, then I would encourage you to bring those items back to the board. I'm going to turn to my fellow board members. Do you have any comments?
Just want to make one more comment and just a slight clarification. Once the board ratifies this, we have to send the rate application to the state. So they have 60 days, so it will take effect June 1st.
That's fine, but from my standpoint, I don't want to wait 60 days.
Oh, no, I didn't mean, yeah.
Exactly.
I just want to be clear about the wage. The providers that receive benefits, there's about 810, 820 this month that receive benefits through a trust, and the trust board met yesterday, and we are exploring options for this month. Initially, we're not going to remove people that have lost hours until we find out if we're able to ascertain we're going to be able to find out even if did they lose hours because they stopped working, or did they stop working because of the COVID-19 situation. We are approaching our vendors. Our major vendor is Kaiser, and the IHSS is about half the trust members, about 7,000 IHSS members. We're approaching to see if we get some kind of discounts, primarily because there's going to be very low utilization as far as, there's no routine visits, you're not getting your knee replaced or any of those types of things. And that would allow us to perhaps leave people on the coverage longer without running up against any financial issues. So we are taking a look at a way to be able to continue their health benefits so that if they are sick, getting treated, we'll still be able to have that covered.
Great. Thank you. And again, congratulations to everybody for getting this agreement. It's positive. It takes a lot of uncertainty away at a time when people are really looking for certainty. So thanks to everyone involved. Okay, I'm looking for a motion on this item.
Motion to approve.
Second.
We have a motion and a second. Please cast your votes. And the motion is approved, 5-0. Thank you.
Thank you very much.
All right, so I'm going to reconvene the Board of Supervisor meeting. And then I'm going to recess it again very quickly and announce that we will now be acting on the next item as the governing board of the San Joaquin County Flood Control and Water Conservation District. I'm going to convene that Flood Control and Water Conservation District meeting. We have another item on consent. Does anybody have any pressing questions? Yes? If not, I'm looking for a motion.
I'll make a motion to approve.
Second.
I have a motion and a second. Please cast your votes. And that motion is approved, 5-0. Thank you. Yep, I was looking, I should have actually called for public comment, but I didn't see a flag from the clerk, so I am assuming we did not have any on that item. Thank you. So we are now reconvening as the Board of Supervisors to address a discussion item.
Good morning, Chairman, members of the Board, County Council, CAO Monacanino. I'm Marcia Cunningham, the Director of Emergency Services. I'd like to first go through an agenda and how we will present to you today. First, we're going to hear from Public Health, then the Office of Emergency Services, followed by Healthcare Services. Finally, I will cover the local emergency proclamation. We'll get public comments and questions in regards to the proclamation. I'll then ask the board to adopt the resolution ratifying the proclamation of the local emergency. And lastly, we will provide information at the stay-at-home order. So at this time, I'd like to ask Public Health to come to the speaker.
Thank you. I'm going to give them a little time since we're spread out. Greg.
Dr. Park.
Board members, we've been trying to keep everybody separated. We might have turned some of these speakers down on location.
Thank you. Dr. Park, thank you for being here today. We know you've really been working around the clock, and we appreciate this update from you.
No problem. Thank you for having me. So I'll start with a quick update on our current COVID-19 numbers. As of this morning, San Joaquin County has 55 confirmed cases of COVID-19, and our death toll stands at 2. The state of California has 1,733 cases with a death toll of 27. We are working hard at public health to try to reach our most vulnerable populations. I now have a team of nurses that are focused on working with skilled nursing facilities only, as they house many of our elderly and at-risk population. We are going into nursing facilities, living facilities, where the elderly are, and making sure that the staff is prepared with PPE. We are going to be supplying them with PPE in the anticipation that there might be some COVID-19 outbreaks coming up or some positive cases. And we're reviewing their facilities for their ability to isolate some positive cases, coming up with guidance for them as well on paper. We continue to reach out to the public as best as we can, although many organizations are now following the shelter-at-home guidelines. We are able to offer small group lessons with our health educators, as well as access remotely through video webinars and YouTube webinars. We have been at homeless shelters with our health educators, teaching prevention methods and talking to staff about the best methods that we could share with them. We have now a phone tree system, and calls that are made to public health with requests for information for COVID-19 were being handled at a volume of 150 to 180 calls a day, and we have now transferred those calls to 211, so greatly appreciative of that assistance from 211. Information is now being shared through the JIC, the Joint Information Center, which we discussed last week when we talked about OES. And through that, the PIOs of all of our major entities here at cities and county level are sharing the messages that public health are releasing twice a day, in the morning and in the afternoon. And this messaging is also available on our website at sjcphs.org, the SJ Ready website as well, and various websites that reach out to all of our county residents. We are also offering Nixle alerts through texting, and the public can text 888-777 and enter the word COVID-SJ to be updated frequently on their phone. And I'm willing to take any questions you might have.
Could you repeat that on the text real quick for us?
888-777, enter COVID-SJ.
Thank you. Supervisor Patty?
Thank you, Madam Chair. I have actually texted that in and done that process and received nothing in the last 48 hours. Zero. So that's actually had a question. Am I supposed to get something hourly, daily, every week? I mean, we've seen numbers climb and there's zero information that's been filtered to me through that process. Is that system working?
I believe it should be working, and I don't know if OES could answer that better than me.
I'm Shelley Lima from the Office of Emergency Services. The system is a partnership that we have with our Sheriff's Office, who has the Everbridge system already in place. And I know for certain that on Sunday, March 22nd, and a report came out at 11:45 a.m., that said stay-at-home order has been issued by San Joaquin County, effective until further notice. Find out more, and it gives a website. So I wonder if there was an error. You should have received a code or some information back to your text message whenever you texted that information out.
So then maybe it's the information that's being shared is if last information sent was Sunday morning from the Sheriff's Department, and that's the last message, then there's no new message.
Correct.
Okay, so what's the purpose of this then?
Share updated information as we get it. Today's Tuesday, right?
Okay, well, for instance, to me, updated information is we have 55 cases in San Joaquin County. Yesterday was 44, so we've got information that seem to be in real time, but that's not shared on this app, so I don't know the purpose of it then.
Behind you. I'm trained to sneak up on you like that. I just did it, and it came through a big long text like this instantly. So I did the 888-777, and then down in the text message area I put COVID-SJ, and then they sent a bunch of stuff out to me.
Yep, no, I've done that, and I have a recognition, but it says you're now signed up for important updates from San Joaquin County around the COVID-19 pandemic. Reply your zip code for target and social alerts. I did that. Thank you for your zip code will be used to send messages in your area. And that was the last time that happened was on Sunday at 6:07 p.m. So Monday, nothing. Tuesday, nothing.
So I'd just be assumed that in your zip code then there was no new information that they have for you there. It doesn't sound like we're doing blanketed all over the county or updating the numbers or anything else. It's just for targeted areas. So if there's a hot spot or something like that in that area, then you'll instantly be alerted in your specific area.
Understood. Okay. Thank you.
Yes.
Are there any other questions for Dr. Park? Supervisor Wynn?
In addition, Dr. Parker, we're going to have a presentation from Director Cunningham, because I have a lot of questions about, as Supervisor Patty has raised, about the information that we're releasing to the public, and some of the questions that are asked. So is that something that Director Cunningham will answer? Or?
I think it would be best to let us get through our presentations. I think a lot of what you may need to ask will get presented.
Okay.
And then if not, we can just address it at the end.
Sure.
Okay.
Thank you.
Thank you.
Okay. Next, I would like to introduce the Director of Emergency Operations, Shelley Lima, to share response efforts of the Emergency Operations Center in the disaster declarations and what they mean to San Joaquin County.
Good morning. I'm Shelley Lima with Deputy Director of the Office of Emergency Services at the San Joaquin County. On Friday, March the 13th, San Joaquin County Office of Emergency Services activated the County Emergency Operations Plan, which included activation of the Emergency Operations Center in support of ongoing operations, at the time primarily driven by County Public Health Services and the Emergency Medical Services Agency in response to COVID-19. OES currently provides support and coordination as requested, and OES response needs have increased significantly over the last week and continue to provide day-to-day support through planning, logistics, financial tracking for response to COVID countywide. This event has been unlike any event OES has responded to in the past. As a leader in OES, I understand the need to adhere to special guidance and health officer orders to protect our staff as well as our citizens. While OES uses standard organizational response for COVID, while OES uses the standard organization response for COVID, as we have for flooding in the past, we have had to significantly modify our operations to support social distancing requirements. This means that much of our work is completed during conference calls. While the technology has presented some issues, our county OES staff has risen to the challenge. The county and its 7 cities' executive leadership, comprised of elected and appointed membership, making up the San Joaquin County Multi-Agency Coordination Group, known as the MAC Group, has met 2 times since this board meeting last week to discuss and coordinate significant issues and policies related to our response efforts. OES conducts daily situational briefings every morning to our stakeholders for informational sharing, planning, and resource needs. OES has activated the county's Joint Information System, which is responsible for ensuring messaging to the public is frequent, consistent, and ongoing, although not overwhelming. This team has worked tirelessly to draft information documents and translate orders and press releases for non-English speaking citizens of our county, and development of informational videos that have been released on various forms of social media. The Joint Information System is comprised of PIOs from all of our cities, the Office of Education, the Port of Stockton, and of course our county. As part of our response effort, we have updated our San Joaquin County, our SJReady.org webpage to include links to various guidance documents that have been developed at both the state and local level as arise needs, and have added the lists of frequently asked questions to help the public navigate the latest directives by government officials. OES financial section is responsible for the tracking of costs related to the county's overall response, and while not all departments have submitted figures in relation to their current expenditures to date, including 3 of our 7 cities, the current price for this event is just over $2 million, primarily staff time. As a result of the governor's state of emergency proclamation on March 4th and the presidential major disaster declaration, which was awarded yesterday, San Joaquin County is eligible for both state California Disaster Assistance Act, CDAA funding, as well as funding assistance under the Robert T. Stafford Disaster Relief and Emergency Assistance Act, known as the Stafford Act. The Stafford Act provides reimbursement through a public assistance program for eligible protective measures taken to respond to the COVID emergency at the direction or guidance of public health officials. Eligible applicants will include state, local, government, special districts such as schools and community service districts, and some private nonprofit organizations. Eligible assistance under the Stafford Act includes Emergency Operations Center cost reimbursement, emergency medical care provided by medical facility services and supplies, temporary medical facilities, and enhanced medical and hospital capacity. Additionally, items like medical sheltering, purchases of food and water and other consumables, security and law enforcement, and reimbursement for local government force account overtime costs. In addition, as I mentioned during my last update, San Joaquin County small business, small agricultural cooperatives, most private nonprofit organizations of all sizes are eligible to file for economic relief under the U.S. Small Business Administration Disaster Assistance Program. Economic injury disaster loans provide the necessary working capital to help small businesses survive until normal operations resume following a disaster. Loan amounts do vary, and interest rates are at 3.75% with terms up to 30 years. The San Joaquin County Delta College Small Business Development Center, a partnership program with the Small Business Association, the Small Business Administration, and other state and local partners offer free support to our businesses of our community and may be a great resource to assist our impacted business owners in obtaining the necessary assistance that they need at this time. It's important to note that with the presidential declaration, the minimum cost thresholds have been waived for San Joaquin County. While all disaster costs may not be eligible for reimbursement under federal or state programs, OES is carefully monitoring, documenting, and tracking to ensure we get the most reimbursement allowable to help our county to return to normal. Thank you.
Thank you. Questions for Ms. Lima? Supervisor Wynn?
Last week at the meeting, we did talk about your department in regards to assisting cities or other agencies in reimbursement because oftentimes they don't have the personnel or the knowledge or experience to handle these applications. So do you have somebody or maybe a group on your staff that are up to date in regards, because especially, I don't know if it's passed, but there's another bill in Congress that's going to be passed for financial reimbursement for a variety of things. Does your staff keep up on all these changes that are coming from the federal government, state government, and at the same time provide that information, or at least make it known that it is available from your department, so that whether it be a city or a nonprofit or whatever, that they can contact you or your staff, and your staff can guide them through the process, because it is complicated, and unfortunately, in my experience, it changes frequently before you get to the end product. So that's my question.
That is certainly true, and it's true with all of the things that we're doing with FEMA as well for our county. And we are working to find people and support staff that are able to fill that and learn more about it. They have streamlined many of the processes. In fact, the Small Business Administration has all of their processes online now. I went through it over the weekend. If you can fill out a loan application, it's relatively easy. I was actually kind of surprised. There are some numbering, things like that you might need to be aware of. And so these are things that we're working in our recovery plan to try to pinpoint how we can help. So there will be some sort of process or training or workshop of some sort that will be able to help the community.
Well, I know on our county website that we have bars, with specific titles so people can navigate and get particular information. And I guess the one thing, though, is that when you hit one of them, oftentimes, for example, like these documents show up, but it also, they oftentimes have links to whether it's federal or state. And I was looking for the change from the essential businesses to the essential occupations. It took a while to track that down to get that list, that 14-page list. And I guess my question is, why can't we, instead of providing the links, why can't we label a bar of what somebody may be looking for, certainly the most frequently looked at items? Because, for example, and I had to hit on all three, and one of them was redundant that I'd already seen. So my question is, just for the average resident who doesn't deal with this all the time, it would seem to me that we would have a label. This is what this goes to, and then link it directly to that website. Because my experience, especially with websites, government in general, is it's like, following almost a rat maze. You're going from one place to another. And I think that we should make it simple enough that the public can just hit a button, get what they want, and not have to follow this trail. The second thing is, and maybe we'll talk about this later in the presentation, but with the last meeting we did talk about our county offices and departments and whether they are going to be open or not open, their hours availability or availability at all with the public. Again, I know on our website we have our departments listed, but it would seem that, and I know it depends upon department whether they're mostly outdoors or they're indoors, or maybe they're even mandated by law to stay open. I mean, there's certain things that I'm not aware of, and I'm sure Ms. Nino is aware of, and probably Human Resources. But my point is that all of us, I'm sure, are getting questions either personally or by emails. And frankly, I've made interpretations, but I'm not sure it would be consistent with my fellow supervisors. And I think it's always dangerous when you have this kind of this patchwork of responses that aren't consistent. And I'm not talking about this county, I'm talking about the cities also. Because I think one of the things is we need to coordinate information so that it's the same from every entity, whether it be a city, county, supervisor, whoever. And that's, so again, those are things that I think we could maybe provide better access, simpler access for the public, because they are truly anxious in this time of what's happening. And along those lines, and maybe I'm ahead of the presentation, but also I think that questions come up about, for example, a landscaper or gardening service who are not working because they don't fit the agricultural criteria in their mind, and yet I see a ton of them in my neighborhood, and so some are making their own interpretations. And I guess the question is, if a business has a question as to whether they're essential, and I hate to have this, I mean, I shouldn't say hate, but I know we have this list, but for example, if you had a welding shop and you're not agricultural or whatever, maybe you can fit it in construction, but if you have two welders that are on opposite sides of a 100-foot building, so what? I think sometimes we I want to say emphasize certain occupations or businesses. This isn't the week because of the potential spike, but what I'm saying is that I think we need to have a more engaged discussion as to what we think, we being San Joaquin County, think are appropriate. And then the other part that I hear a lot of, especially from the president and other experts around the nation, is the economic side and the releasing or downgrading some of the restrictions that we currently have in place. So I understand the health side, I understand the criticality, but for example, where are we? Because if you want to watch Mayor Cuomo or Governor Cuomo every morning, he has a talk and very specific. But my question is, with our 7 hospitals, where do we stand in regards to beds and as far as ventilators and as far as masks? And we talk about in-home support services. The question arises is, as some agencies, like healthcare agencies, if you come to work, they take your temperature. If you're in the press briefing with the president, they take your temperature. I'm not a medical expert, but all I'm saying is it seems there's some limited precautions that we can take to protect our employees, protect the public, protect businesses. And we haven't had those discussions, and we haven't made any decisions either as a board or staff. And I think we need to be more, I don't want to say engaged because I know we're engaged, but more vocal in regards to our discussions and decisions, because we've all gotten the emails, and I think that, oftentimes the public is questioning or makes the statement that they don't know, or they're in the dark, or whatever, and we need to change that. And I guess I would add, I think the board needs to be meeting weekly, not every 2 weeks, because this is the second time this board has had a discussion on COVID-19, and this thing changes daily. And so the board needs to be engaged. We have great staff. Obviously you're all doing your jobs, but ultimately the responsibility lies with us, and it shouldn't rest upon your shoulders. If something goes south, that it's your fault. It should be our fault, or at least our responsibility. So those are some things that I throw out there, just because I get the calls and the emails like the rest of my supervisors do, and I just think that we need to be. And I know after this meeting we're going to have a press conference of sort, or a presentation. So I don't know. I mean, that's what my email says.
So I'd like to just make one comment, and then I know Monica wants to speak, and I'll get more into it when I start to speak about the order. So as we're making decisions, we know that the state governor has a state order. Okay, so at a local level, we can be more strict. What we cannot do is be more lenient. So, and I'll get more into that as we move forward, but I think that was an important point to make. And then I'll let Monica, I know she wanted to talk about services.
So Supervisor Nguyen, we have done some preliminary work with our department heads. A number of them, starting last week and prior to last week, started evaluating their essential services. Upon the conclusion of our local emergency presentation, we'll bring up a few slides to respond to your question. We have not gone through and determined whether that landscaper is an essential work function within our community. We've been very focused, my office in particular, and all of our department heads, in identifying our essential services. Because our goal is, this week, is to put up on multiple websites, SJ Ready, our San Joaquin Gov website, and if public health needs it, what those essential services are for San Joaquin County, along with the hours of operation, because one of the conversations and direction we would like from the board today is about closing to the public. You received a few letters from a few of our elected officials last week about bringing an item on April 7th to close to the public, but we would like your input in that regard, and direction in that regard, because there are a few very easy to, not a link, but it just listed hours of operation. If you're looking for child support services, what are their hours of operation? Is it appointment only? Or, can you still walk in through the hours of 8 o'clock in the morning till noon? I'm not sure, but our goal is to have that. But we'll have, and Mr. Becker will present those few slides upon the end of our discussion today to kind of share with you that there is a lot of work being done on the county's essential services. Okay?
Thank you. Questions for Ms. Lima? Okay, Ms. Cunningham.
Okay, at this point then, I would like to introduce Chris Woods to give an update on shelter and care.
Good morning, Chair Miller, members of the board. Chris Woods, your Director of Human Services. In terms of, there's a lot of movement at the state level. I'm sure you've all heard in terms of shelter and care. The state has, put out $50 million and then sort of pulled that back. The $50 million was originally put out for counties to essentially take over hotels in entirety, manage those hotels, and I say manage those hotels because that's exactly what I mean. The hotel staff would leave and local jurisdictions would take over those hotels. That was sort of a nuclear option, and thinking about how that was presented, and we were immediately hearing that and thinking we need teams on the ground to learn simple things like card key systems, laundry systems, and all of the things to operate a hotel. That quickly changed again, and I'm learning how operations and emergency services, everything changes minute by minute. And we are awaiting direction from the governor's office, and I was in contact over the weekend with the California Department of Social Services and their chief operations officer to confirm the understanding that was the most recent information. And this money is really on hold at this point. We're waiting for the state to have a plan approved by FEMA, where the state would take a more active role in this operation. I'm assuming that that active role would also include activation of National Guard support to operate these hotels. The county and local jurisdictions would be charged with transporting, for one, determining the individuals from the shelters that would be transported to each location. There would be various locations for whether it is just purely to protect individuals and bring them off the street. There would be a different location for individuals who have tested positive and other locations for individuals who are symptomatic. So the local jurisdictions, we would work directly with our shelters to determine which individuals would go to which locations. We would be transporting individuals and providing, for example, behavioral health support at those locations. This is all, again, pending, and I've again reached out this morning to CDSS to confirm that we are getting the most up-to-date information. There is a local effort, again, in terms of looking at other options using HHAP funds that the county has through the COC. I know Adam Cheshire has been involved in this. There's a task force as well, led by David Tolliver, which I really appreciate the support that Marcia has given us through David Tolliver, looking at local hotel options in lieu of, and if the state process does not materialize. But more importantly, I think when I'm going to assume the state process will materialize, just it's taking time, is how do we coordinate the services to support those efforts that the state is working on. So in terms of, I know Adam is, I hate to speak for Adam, but I think that, I know he and I are going to have a call right after this meeting with David Tolliver, but there is an effort to lease space at the fairgrounds to place trailers, and please correct me if I'm saying anything wrong, but as well as that might be a location should we have to activate a local shelter option, and that we could actually have folks housed there in a shelter situation. Ideally, the hotel option provided by the state is the most ideal for what is, in this case, a longer-term shelter need. I'm actively engaged with both Gospel Center Rescue Mission and Stockton Shelter for the Homeless. One, trying to fulfill their supply requests through the Office of Emergency Services. Two is assessing any staffing needs they may be coming up, and soliciting support either through our county disaster worker option, as well as communicating with American Red Cross to solicit support through their process. In terms of what is, I try to look at this as what can HSA do with existing resources. I've reached out, our team has reached out to both Stockton Shelter for the Homeless and Gospel Center. We are attempting to identify those individuals that may qualify under the CalWorks program, even if they have already received temporary homeless assistance through CalWorks, apply any exemptions that the state has afforded us, get them into hotels, and we may be looking at one hotel in particular, only because that way we could provide supportive services at one location and not stress the system anymore. And this is all very developing. And then apply any exemptions, apply the temporary homeless assistance for CalWorks is limited to 16 days, looking at extending that 16 days indefinitely at this point, using our housing support program funding that we have available and supporting them that way. I think that's my update. I know there have been, are there any questions? Sorry.
Thank you. Supervisor Patty?
Thank you. First, let me apologize. My phone, I was making sure it was silent, and I accidentally hit something, so it made noise during your presentation. I apologize for that.
No problem.
Can you give me an update on the status on, you mentioned Red Cross and possibly a National Guard as it relates to support services for activating their volunteer network, in particular with Red Cross. Where are we at with that?
So there are, and I'm learning this process through Office of Emergency Services. Shelley's been very helpful in informing me. I understand that American Red Cross has very specific limitations on the support that they can and will provide in COVID-19 environments. So I actually have, I'm communicating again with the shelters to determine their needs. I need more, I'm working with them. I'm going to reach out to them after this meeting again to determine more specifics about their need, because Stockton Shelter for the Homeless has expressed they are hiring additional staff, but also need additional shelter staff, whereas Gospel Center Rescue Mission is indicating they may have more administrative type support. So really drilling down on what is their need, and then I'm going to communicate that need through our county and American Red Cross processes. So.
Excellent. And I was on the phone with those two yesterday, so they were asking about that possibility. And any status on National Guard coming in? There's talks about putting up a triage hospital in case the event that our local hospital is overwhelmed. Is that going through you guys, or is that through Ms. Cunningham?
So that is not through my role in the emergency shelter and care. But what I can say is, in terms of HSA, the National Guard did reach out and offer us support for our food bank services, and we did take them up on that support. And as additional support is needed, we'll continue to reach out to them.
In that reach out and that offer, did it include any other additional, in addition to food services, anything else by some way of supplies, in particular those agencies that you mentioned, Gospel and Stockton, looking for some basic needs?
So the first part of that question is no, the National Guard did not offer any material support. The support was actually in staffing, specifically related to our food banks. So very much appreciate that. The second part is I have been in contact with both of our shelters. I've taken in their requests for supplies, and I have submitted those requests through the Emergency Operations Center, who is trying to procure those items.
Okay, thank you. Appreciate that update.
Supervisor Wynn?
I know that, for example, in Modesto or Stanislaus County, they worked with the Salvation Army on a building that they then provided beds for the homeless shelter, et cetera, just a big building. Is that, I understand the hotel concept, but has that been a discussion in regards to providing a more large space? Because you talk about, making sure resources are collected in one space. Has that been talked about at all in regards to a large, like a gymnasium or some large facility as opposed to a hotel? And the reason I bring that is we don't know how long this is going to last. So the question is, would that be more of a long-term solution than a hotel, which may, when the economy comes back, that they may want to take that hotel back?
So I think from the state's the state model provides the property owner with 100% occupancy for 30-day increments with 30-day notice to terminate. So at the immediate onset, the property owner will have 100% occupancy for at least 60 days, and then 30-day increments after that. So I think in terms of the economic impact on the property owner, they're actually benefiting. I don't think they'll be at an economic disadvantage. But yes, we are looking at, one is the fairgrounds, and looking at shelter options there. Primarily, the initial indication is that we're going to certainly attempt to place trailers there. Adam Cheshire and his team are working on that. Second is actually Salvation Army Supervisor Villapuda's office reached out to me this weekend. I reached out to Salvation Army with the contact that was provided through Chris Rapay and Supervisor Villapuda's office. Spoke with him yesterday. They have operations going on at that site right now, but they can make adjustments to make it available to us, so that is on our radar.
I appreciate that, and I know Supervisor Pudman and his chief of staff worked very hard in their district. I guess the thought is, and I understand, I appreciate the 100% reimbursement for the hotels, but when this ends, when the COVID crisis is over, whenever that is, July, August, September, it would be nice if we had something that was already in place to continue that housing or shelter for homeless, whether it be at the fairgrounds or some of the places we've talked about. Again, I'm just looking at the long term as opposed to the short term as far as this particular crisis, and looking for the long term as far as getting some of these individuals off the street and into a sheltered facility.
I 100% agree, and then I will share that on our CalWorks temporary homeless and transition into a housing support program, I fully intend on that population. We have existing programs through our Housing Works to ensure that we engage them early to develop an exit strategy and an exit permanent housing. So
great, thank you.
I just wanted to comment also, I know a number of the supervisors have provided contact information, Supervisor Patty, Supervisor Miller, all of you, in regards to potential availability, if not supplies, but locations, and those are sent through to the appropriate teams and followed up on. Sometimes we can take them forward and sometimes we can't, but the information is appreciated.
Thank you. This isn't exactly in your wheelhouse, but since we're talking about homelessness, I wanted to touch on prevention in terms of our current rental assistance programs. Is that something that can be beefed up so that we help make sure that more people don't fall into homelessness that are on the edge right now?
If I may just volunteer in terms of, our team at HSA has been working diligently to ensure that we are remaining available and connected to the community, because I know that with the economic downturn, we've already seen the increase on demand for our services. So I just want to let this board know that we remain available to the community. We're encouraging folks to apply online and by phone, and we want to ensure that our services don't diminish during this process. And during this emergency. So we continue to provide all of our CalWorks, Cash Aid, CalFresh, and Medi-Cal assistance through our agency.
Great. Thank you.
Madam Chair, the number of conference calls, especially the ones focused on the immediate needs of homeless and potentially them being able to have a level in the event that there's a part of that population that's infected as a result of COVID-19. That's been the real focus of the immediate $50 million that's being distributed among all the counties. That was very much the focus as part of the conference call. The state of California has been extremely impressive in this regard. We were on a call, I think it was either Monday or Tuesday evening, 5 o'clock conference call on this $50 million. They said we were going to have letters of confirmation of us receiving this money. We received our letters for both our San Joaquin County Continuum of Care and also San Joaquin County. The city of Stockton is also going to receive a source of funds, but they were very focused, and I sat for that whole call, very focused on assisting these folks and putting in some temporary shelter so that if we have an infected population, that there's a level of separation and that they're cared for and that there's follow-up for a fixed amount of days. So I just wanted to share that.
Thank you. Thank you all.
Okay, Marcia Cunningham. I will address the local emergency. On March 17th, the existence of a local emergency was proclaimed in response to the novel coronavirus known as COVID-19. When it is determined that the effects of an emergency beyond the capability of local resources to mitigate effectively, the local government must proclaim a local emergency. In accordance with our San Joaquin County Ordinance 4-305, Section A1, the Director of Emergency Services is empowered to proclaim the existence of a local emergency when the county is affected or likely to be affected by a local calamity. When the board is not in session. So why did we proclaim the local emergency when the state had already done one and the public health of San Joaquin County had proclaimed their local emergency? San Joaquin County has worked closely with the California Department of Public Health, the Governor's Office of Emergency Services, local health departments, and emergency management agencies. Recent events within California had increased the need for staff support, resource procurement, and evaluation of community health needs. What does our local emergency allow us to do? It allows for the potential liability coverage for disaster workers while performing services related to this health response. It allows the county governing body to enact ordinances for emergency protection measures for life and safety. For example, clarity in our order in regards to the stay-at-home order and how police power will act in regards to what's in place today. Immunity for emergency actions of public employees and governing bodies. Requisition of necessary personnel and materials from departments and local agencies. To leverage response resources and state funding available from the state. At this point, we knew we were already covered by FEMA, but some of the other funding had not been available as of yet. And it activates pre-established local emergency provisions such as special purchasing and contracting that we can act on. On March 4th, the governor had declared a state of emergency to make additional resources available, formalized emergency actions already underway, and began preparations to help the state prepare for the spread of COVID-19. As Shelley mentioned, it activated the California Disaster Assistance Act, the CDAA, which provides financial assistance for items such as replacing public property or local agencies' overtime costs and costs of supplies used in this response. It allows the governor to make use of private property or personnel, assist with finding shelters for the homeless. The state emergency also waived the requirement of the Board of Supervisors to renew our local emergency every 60 days and the local health emergency for the duration of the statewide emergency. At this point, I'd like to know if there's any comments or questions in regards to the local emergency.
Any additional questions? Board?
Okay. So, in closing, per law, we are here today asking the board to adopt the resolution ratifying the proclamation of the local emergency in order that it stays in effect. And upon approval from the board, we will forward our ratification of the proclamation of the local emergency to the California's Office of Emergency Services. San Joaquin's County proclamation will then remain in place until terminated by the Board of Supervisors via a resolution.
Thank you. So I have a question for the CAO. Questions, we received a lot of questions. In fact, almost exclusively the public comment was from employees. Is this the time to get an update on our efforts within our organization to provide clarity not only to our own employees but to the public, or would you rather take those after we have action on these first two items?
I would appreciate taking them when we discuss the HR. Mr. Miles is going to ask this board to consider adding another item to the agenda, which relates to some recent legislation that will impact our county employees. So I would appreciate those questions then, Madam Chair, for your consideration.
Perfect. Thank you so much. So then at this point, I'm looking for a motion and a second, unless there are additional questions to approve this item.
I'll make a motion to approve, but on, Madam Chair, on your point, even if we approve this, would the department heads and the people that are here stay and participate in any questions we have from a board, even though we're passing these resolutions? Thank you.
Second the motion.
All right, we have a motion and a second. Please cast your votes. And this is approved 5-0. Thank you.
Okay, the stay-at-home order. Why a local stay-at-home order? Our order was effective as of March 21st, 2020 at 11:59 a.m. The stay-at-home order was issued from the Public Health Officer, Dr. Maggie Park, and myself, Marcia Cunningham, the Director of Emergency Services. The order is effective until 11:59 p.m. on April 7, 2020, until it is extended, rescinded, suspended, or amended in writing by the Director of Emergency Services and the Public Health Officer or by the Board of Supervisors. The order is directing all individuals living in the county of San Joaquin to stay at home or in their place of residence except to leave to provide or receive essential services or engage in activities and work for essential business and governmental services. Exempting individuals that are experiencing homelessness, but urging them to find shelter and government agencies to provide it. The order directs all businesses and government agencies to cease non-essential operations at physical gatherings at any number of individuals. Prohibits all non-essential gathering of any number of individuals and orders the cease of non-essential traveling except when practicing social distancing. This order applies in all of San Joaquin County. The order incorporates by reference the directive from the State of California's Public Health Officer designating essential critical infrastructure workers found at covid19.ca.gov. This was done in our order to ensure the most current information was available from the state because it was continuing to be changed and updated, and that way we would continue to have the most current information associated with our order. What does the order do? This order requires that, starting at 11:59 on Saturday, March 21st, 2020, that residents in San Joaquin County are to stay in their place of residence unless performing an essential duty. For most people, this means you and those you live with should remain at home. You are allowed to leave your home for specific reasons to make sure you have the necessities of life, such as getting food and medical supplies. You are also allowed to go outside to take care of pets, go on a walk, exercise outside, and just get outside, so long as you do not congregate in a group and maintain at least 6 feet of distance between you and other people. Why is the order in place? Due to the outbreak of COVID-19 virus in the general public, which is now pandemic, according to the World Health Organization, there's a public health emergency throughout the county. Making the problem worse, some individuals who contract COVID-19 virus have no symptoms or have mild symptoms, which means they may not be aware they are carrying and spreading the virus. Because even people without symptoms can transmit the disease, and because evidence shows the disease is easily spread, gathering can result in preventable transmission of the virus. The scientific evidence shows that at this stage of the emergency, it is essential to slow the virus transmission as much as possible to protect the most vulnerable and to prevent healthcare systems from being overwhelmed. One proven way to slow the transmission is to limit interaction among people to the greatest extent practicable. By reducing the spread of COVID-19 virus, the order helps preserve critical and limited healthcare capacity in this county. Why now? With the increase in cases of confirmed COVID-19 in the county and deaths, this order is necessary to slow the rate of spread, and the Director of Emergency Services, as the Director of Emergency Services, we will continue to reevaluate as the data becomes available. Additionally, this order implements the Executive Order N-33-20 issued by Governor Newsom on March 19, 2020. What does this order mean? The order means stay at home. Stay in your home. Do not leave unless necessary for one of the designated exceptions listed in the order. Some reasons, again, you would leave would be to get food, get prescriptions, see a doctor, go to and from work, if it's an essential function that is defined in the order. Take your children to and from childcare, again, as authorized within the order and to help people you care for get the things they need to live and be healthy and safe. What is the distance between staying at home and social distancing? Staying at home is a more rigorous form of social distancing. There are some differences. Staying at home means only going out for essential activities, to work for an essential business or for essential travel, as those terms are defined in the order. Stay 6 feet or more away from others. No formal gatherings. The other mitigation measure of social distancing and personal hygiene will continue to be applied whenever feasible. This includes washing our hands, using hand sanitizer, disinfecting surfaces, not going out if you are sick, and staying at least 6 feet away from others. Is our order mandatory or just guidance? Yes, it is mandatory. This is a legal order issued under the authority of California law. You are required to comply. It is also critical for everyone to follow the order to prevent the spread of COVID-19 and protect themselves, their loved ones, their friends, their neighbors, this whole community. All persons, businesses, and other entities are required to comply if they do not fall within the exceptions of the specified order. What are essential activities? Again, we've covered most of them. You can engage in activities to perform the task essential to health and safety for your members of your household, such as obtaining medical supplies or medications, visiting a health care professional, or obtaining supplies needed to work from home. To obtain necessary supplies for themselves and families. This includes foods, fresh fruits, vegetables, pet supplies, fresh meats, fish, poultry, and other household consumer products and products necessary to maintain safety, sanitation, and essential operations of your residence. To engage in outdoor activity. Again, practice social distancing requirements, such as walking, hiking, biking, running, are some of these activities. To perform work providing essential products and services at essential business or otherwise carry out activities specifically permitted by the order, including minimum basic operations. To care for your family member and pets in another household. To, again, private gatherings of not more than 6 non-relatives in a home or place of residence. Participants, again, should be practicing social distancing requirements at all times during these gatherings. Who do I call if I suspect the order is being violated? If you suspect there is a violation of the order, you may call the non-emergency number of law enforcement agency that provides services in the jurisdiction where the violation is occurring. This response that I gave is an answer that was stated and agreed upon by the agency heads for city police departments and the sheriff in San Joaquin County. What is the role of law enforcement officers who investigate the suspected violation? Assuring the safety of the public is always a primary role of law enforcement agencies. Officers who investigate suspected violations will evaluate the circumstances and determine the action they should take to ensure the safety of the public. In many cases, educating community members on the best ways to assure their safety, and the safety is all that will be necessary. What I do want to point out, though, in the order, and again, our approach is to take the softer hand and to educate. Most are following the order. But in violation of the order or failure to comply with this order, it could be a misdemeanor punishable by fine, imprisonment, or both, based on California Health and Safety Code Section 120295. Again, though, I want to reemphasize that our approach right now is to educate, to take the softer hand. It's a new world. We have to find a new way to do business. And in most cases, that's helping. In most cases, most people have complied. Where can I get information? That's been shared with most of you. I will share it again. sjgov.org under the COVID-19 information tab. sjready.org. Public health, you can call 211 24 hours a day, 7 days a week to access questions and services and reply to your needs. We will also continue to work on improving what we're presenting. The suggestion of making it, maybe have a business bar that said, or a business bar where it would directly supply information related to businesses or schools. Great idea. We will look at making that happen. Along with our order, we have created a FAQ to try to streamline a lot of these questions that are coming in. We will continue to add to that. We will continue to share information as it becomes available. Again, every day there's something new. Daily we hear from the governor. Daily we hear from the president. I believe Governor Newsom has had 11 different executive orders. This is an evolving pandemic. We need to remain flexible. The key here is stay home. The sooner we do it, the sooner it will be over. Practice what's been asked as far as washing hands, sanitizing, practice the social distancing. It will make a difference, and that's what we're here talking about today.
Thank you. Questions? Supervisor Elliott.
Thank you, Chair. One question. Now, the state recently issued an order to close the state parks. But now, based on your guidance here on our stay-at-home order, one of the things that is an appropriate reason to leave your home is to engage in outdoor activities. Why are we now closing our county parks as well? That would seem to involve much less travel than perhaps going to the state parks, not as likely to attract large gatherings. Why would we not want to facilitate people's ability to engage in outdoor activities by keeping the county parks open?
One of the reasons is the availability of staff and the resources we have based on COVID-19 and what we're being asked to practice. Another reason is without closing them, it sends a mixed message and is confusing to the outside world. Again, they can go and walk at the park and practice social distancing. From a staffing perspective, though, it necessitated us closing the park.
Okay, so when you say walking at the park and practicing social distancing, is that possible or not right now? I mean, if the park's closed, you can't go in there and walk, can you?
There's a number of people who live by the parks that I suspect would go and walk the parks. Still, as they do, there's a lot of people early in the morning. They would not get a violation. The reason to close the park is because we do not have the staffing to man the feed booths and continue to maintain the parks at the level that we currently are.
Okay, well, I wasn't really talking so much about keeping booths open, but to allow a place for people to go hiking. I mean, that was one of the things that you mentioned was an authorized reason to leave your home was to go hiking.
Sure, and they could walk in their yards. They can go to trails that are in their areas.
Okay.
Again, social distancing.
Okay.
And if our parks are open, I believe too that we have fees that are associated with the park's order that are associated with them being open, although we could do the honor system.
Okay, understand. Thank you.
Supervisor Wynn?
On the bar you were talking about, you might include in that bar a space for questions so that individual businesses or whatever can ask a question, which would then be followed up by whatever committee or department that would be responsible for that. I think that would help a lot, certainly from some of the calls and emails that I've gotten on issues. And you raise a good point in regards to treating this seriously, because I guess some of the things that I've read or received is the mixed message in regards to some departments or some businesses being open, others not. And I think for consistency's sake, and I think to send and reinforce a message probably on a daily basis, is that we need to remind individuals that this is a very dangerous and lethal virus that, as Supervisor Elliott, I don't know which park I was thinking of Mickey Grove since this is my district, but I will tell you that if you go and play on the playground equipment, you touch it, and kids are probably some of the germiest humans on the planet. So I can see the concern in regards to making sure that, and I think we lose sight of surfaces that and how long the virus will stay on a surface. So it's not just the coughing, the sneezing, et cetera. It's making sure that people don't come in contact with something that's been touched by somebody they didn't even see. And I think, but I would agree, as you stated, I would agree that we really have to emphasize that we're not, this isn't a game. I would offer, though, one of the challenges in creating violations of law is that you can't just throw it out there and hope for the best. There has to be some enforcement, otherwise it means nothing and people violate it. And the other question is I know the Sheriff's Department is already probably busy, as police departments are. Does this ability, because I see, for example, some of the more serious violations, businesses that are not essential, that continue to stay open, which then exacerbate the problem of contamination. It would seem to me that our, and I don't want to lay this on them, but our code enforcement, because to me it would be a civil fine for a business to be closed and not continue that operation. I know we're in the developmental stages, but that's why I think we need to have almost daily discussions on these issues, as I'm sure you're aware, and I'm sure the sheriff will be aware of situations that arise. So once we've addressed that particular question or issue, we can apply it. Everybody knows, so we don't have to continually reinvent the wheel. So again, thank you.
Through the chair, Supervisor Wynn, to
Yes.
your last point about enforcement, I have a conference call with the city attorneys set for Wednesday, and that's one of the topics that we're going to discuss. I know that Lodi has developed sort of a four-phased approach. Their first contact with any business, they're proposing to be an education visit. You're not supposed to be open. Here's the rules. Please shut down. The second day will be a reminder. The third day will be a citation, and the fourth day will be some action to actually abate. So that'll be part of the discussion that I have with the city attorneys on Wednesday.
When you say the action, because I know, for example, city attorneys or county council can do civil administrative actions. Is that considered also an option in regards to it, as opposed to a police officer or deputy sheriff?
As far as the actual action, the legal action, yes,
Right.
it'll be administrative action.
Okay, so
the contact and the citation, at least from Lodi, I believe, is coming through their police department.
okay, all right, but we would have the flexibility at some point in time to have code enforcement, at least in the county, code enforcement to handle those complaints.
Yes, that would be possible.
Okay, good, thank you.
Great. Other Supervisor Elliott.
Thank you. A few additional questions. So the question has been addressed in the past here concerning the differences in policies from one county to another. So if we have different county guidelines on residents that live in one county but commute to work in another, what guidance do we give them in terms of which guidelines take precedence if there's a difference?
So if they work, let's say they live in Sacramento, but they work in San Joaquin County. So based on and let's say they work for San Joaquin. If they are an essential worker, they are allowed to come to work. So if you live in one county and you're an essential worker and you work in another county, you are allowed to go to work.
Okay.
Based on the order.
But only if you're an essential worker. Okay.
Correct.
So who do employees contact? Is this, do they contact their individual supervisors? Or is there a central repository of information and decision-making ability? If a worker believes that they not supposed, but they think that their employer is insisting that they do.
I would recommend, if it's a San Joaquin County employee, that they go to the director of their department. Each of us are working on what our essential services are and handling them accordingly to what the needs are and what it is that each of our areas provide in relationships to a service. Outside business, I would suggest that they could call the 211 line, they could call OES to get an answer if that's what they're seeking.
All right.
We'll look to put on the webpage. I also love the idea of being able to put in a question and it getting routed to the right person or us getting a response to them. We will work on making that available as well.
Okay, and then I've brought this up a couple of other times in other fora, but just please assure us as to what we're doing to ensure the continuance of ag production, considering the importance of the agriculture industry here in San Joaquin County.
Well, I would look to see if Tim Pelican was there to touch on that. I'm not an ag expert, but I do know that the order does allow for farming, growing for foods that go to market. I think it's pretty well defined in the order.
Great, and I just wanted to hear you say it here in public.
Okay.
that we are considering our agricultural
absolutely.
Workers as essential workers.
Absolutely. Beekeepers, fishers, I mean, they're essential to our life. So in putting food on our table.
All right, and that includes the entire agricultural chain, to include those who process the products and get them to market, and as well as those who produce them.
Correct.
Thank you.
Okay. Also, to your park question, Supervisor Wynn made a very valid point beyond the employees about the playground equipment. That's a big thing that we really have to think about, not just from parks, but like I've heard landscaping. Well, I see one landscaper. Let me give an example. Maybe they just have 3. They've implemented how to keep, how to disinfect, make sure they're not sharing tools. They're practicing social distancing. Are they landscaping at an essential business? It's not always going to be an apple to apple, but I think as business owners, you need to ask yourself that. Could I let my employee remote into work? Could they part of the time remote in so that we could do business? Have we implemented everything we possibly can to ensure the safety? Are we practicing social distancing? I think those are critical questions that have to be asked, even when you are in the situation of being able to conduct business. Even though you're on those essential services, you still need to play that out and be asking yourself that, because otherwise it's still part of the problem. I also wanted to add that we're no longer taking reservations for any of our facilities. We've canceled what we've had for the next several months, and we have provided refunds to our customers. Again, because of the counts, it would be the social gatherings. The zoo is closed for a lot of the same reasons as well. I hope that helps a little bit.
County Council?
If I can add to Ms. Cunningham's responses to Supervisor Elliott's questions, the state's order is a statewide order, and it takes precedence over all county and city orders. Cities and counties may adopt orders, but they may be they may only be more restrictive. They may not be more lenient than the state's order. As far as your question regarding travel, if they live out, if somebody lives in for instance, Sacramento County and works in San Joaquin County. The state's order is controlling on that. And the state's order identifies who the essential critical infrastructure workers are, or the categories that fit within there, and those would be the employees that would be providing those services that are allowed to be away from their homes. The county's order implements the state's order, and one of the reasons that the county first issued its order was that when the governor issued his order, there was some confusion, and one of the links actually that was in that order as it was published was a bad link, and people weren't finding the information that they needed about who was essential and who was not. The clerk of the board was receiving a number of calls because people were calling the governor's office to say, am I essential or not? Am I open or am I closed? And the governor's office was actually directing them back to the counties to answer the question. And that was one of the reasons that led to Director Cunningham issuing the order, so that there was some guidance within the community about what were permitted, what types of businesses were allowed to operate or not. So that was on Friday. Late Friday night, 11 o'clock Friday night, the governor issued further clarification on the categories of essential workers. And so Saturday, Director Cunningham and Dr. Park issued an amended order that incorporated that further guidance from the state. So it's our position that the county's order is implementive of, it's not more restrictive than the state's order. On the ag production and food manufacturing is clearly called out on page 4 of the essential critical infrastructure workers list that's been issued by the state. If companies are questioning whether or not they're allowed to be open, that is the definitive list. If they're not within those guidelines for the services that they're providing, then under the state order, they're not allowed to operate. And as I said, counties and cities can be more restrictive, but we can't be more lenient. I hope that provides some additional clarification.
You raised some interesting points, because a question would be like a John Deere dealership.
Yes.
That services tractors, which are obviously almost all used for agriculture. Would that be an essential industry?
I would have to look at the list. I try not to make determinations without looking at the list and actually going through category by category to determine if it is. I know that vehicle maintenance repair is listed in the list. But I don't want to say definitively whether a John Deere, tractor dealership would be included in that or not without looking at the list.
Well, I understand that, but I guess my question would be, or I guess the purpose of that question is, we really need to think of those things, to assist businesses who may not really clearly understand or not maybe have our imagination or maybe our experience. The other question you talk about is we can be more restrictive, but not less restrictive on the, and I mentioned this earlier, but, and Dr. Park would probably be the expert on this, but I know, for example, healthcare facilities, hospitals, they take the temperature of employees when they come to work. And I understand, I'm not suggesting we mandate that, but would it be a good idea to advise businesses that might want to be something they would consider as an option to test the temperature of their employers? Because I'm assuming there's some reason. I mean, I know that last week, I guess, that they were taking the temperature of the press corps in the president's briefing. I don't know, but is that something that is an extra measure to at least protect even county workers as they come to work? Because sometimes we don't know we have a fever, and that would be, again, not mandatory. And on the other part, the last part I'll talk about is, it's been mentioned previously about supplies. In some cases, good luck. I mean, supplies are almost non-existent. So whatever we're going to do, I think that the faster we do it, the faster we receive those supplies, whatever they happen to be. Dr. Park, I'll defer to you on that. I just raised that as a question that some entities are actually applying that to their workers as they enter the door.
Yes, a lot of hospitals are and employers are, but not all, and we have not actually made that an order or mandate. But on our website, we do have guidance for employers, and this is taken from our CDC and CDPH guidance that we receive. So if you go to sjcphs.org, our website, there is a link to all things coronavirus, and if you look under the link, there's a list of guidance documents that we've created, and we have created one for employers. This includes things such as mitigation, such as providing tissues for your employers, providing distance and disinfectant wipes, and making sure that soap and water is available, trying to decrease in-person contact as much as possible in the workplace, putting up posters, using video and telephone conferences, and limiting and canceling non-essential work travel. There's nothing in this specifically that says that we would recommend that you definitely screen employers at the door, but it's certainly an option that employers available on our website.
No, I'm not suggesting we mandate it. I'm just saying that might be something that employers may want to consider, because you're the expert and you put that information out. They certainly.
The problem is, as we have discussed in the past, is that some people might be asymptomatic, so how much are you really reliably capturing anyone who might be harboring COVID and is still able to be a spreader? The science is showing that there are mildly symptomatic people and asymptomatic people, and it's just not it's not really a guarantee that we could say that by screening employees that you would really be able to knock out all COVID-infected people out of the.
I assume that. The reason I bring it up is because, and I understand that, but I think every measure that an employer, and I think most employers by far are very conscientious and concerned about their employees, because one, if they do come and are tested, eventually because they're sick and have COVID-19, it affects their entire operation. So I think every precaution they can take to prevent that is an advantage. So I'm not suggesting mandating. I'm just saying that might be something that employers may want to consider. Maybe the county wants to consider, because it only takes a second, and it's not going to catch maybe those who are asymptomatic, whatever. But even if we catch a couple, I mean, one or two can destroy your whole operation.
And we've had discussions about this as well. And the question is, who would be responsible for doing the screening at the door? That would take another employee to do the screening. How would you take a temperature? Would you have them verbally report that, or would you actually have a thermometer and take everybody's temperature? And that would be, I believe, optional as far as how you would report on temperatures. So there would be some logistics that every employer would have to work out. But the main message is, if you're sick, just stay home, no matter what. If you know that you've got fever, if you know you've got any symptoms at all, whether COVID or not, it could be a common cold or the flu. Either way, we'd want you to stay home. So that's really the messaging we're trying to get out there.
I agree. Okay, thank you.
We have a few more questions here, but I want to get in one for Ms. Cunningham. Yes. I asked this question at the MAC conference call last week. When you say we've closed our parks, has the golf course closed?
We are engaging with them today. I believe they will be closed. So the Mickey Grove Golf Course.
Exactly. And I want to make sure that this topic gets discussed at your next meeting with either the PIOs or with the city managers in regards to Swenson. I am fielding probably 3 calls a day. It's not the course that's the problem. They're still able to access carts, and they are still riding 2 in a cart at Swenson. I am getting outrage calls every day saying, why are they not practicing social distancing? And in fact, since more people are home from work, the numbers have gone up on weekdays. There's more people out at the golf courses riding around in carts together, and it is just really frying people who are keeping themselves in their own homes and trying to obey this order. So I just want to make sure that when we say We're trying to apply this. We want to make sure we send the message. This is serious. The people that drive past Swanson, that is a very trafficked, high trafficked area up and down Ben Holt. And for a whole lot of people who have shuttered their businesses, this is like a poke in the eye every single day when they drive by this. And I do think the messages we send, I understand that both those golf courses the operations are outsourced to independent operators. The fact remains that in the public's mind, this is the city's golf course and it is the county's golf course. And it is our responsibility to make sure that the people that we are contracting with are also being responsible citizens. So.
I want to say that, that this topic of the golf courses has come up in multiple conversations.
Yes.
And just this morning, there was a thread of emails shared amongst the county health officers from other areas. And I will tell you that multiple county health officers, such as in Calaveras, Merced, and Mariposa, all chimed in that they are shutting down their golf courses and that it does not seem to comply with the governor's.
Right.
Just for your information.
Right. I know in Sacramento, I don't know of all the golf courses, but I do know one, it was reported, they went to online only. So it's an honor system, but you can only pay online. No carts are available. There is no food service. The clubhouse is closed and there are no restroom facilities. So if you want to go over and park and you want to pay online and be a good citizen and try and support whoever's operating the golf course by paying, you can go over, but you have to walk and you're expected to maintain social distancing. But I know that that isn't what's happening in a whole lot of places.
No, that's exactly the problem, and the problem with the parks as well is that we would like to maintain these places as open spaces for people to have their daily walks and get some fresh air, but they're not honoring the social distancing guidance, and they're gathering and congregating in these places, and it's inappropriate, and I don't think they understand the seriousness of this disease, potential for anyone to really have it. So just for your information, wanted to let you know that other counties are in support of that and are interpreting the governor's orders.
Thank you. Some more questions up here? Supervisor Patty.
Yeah, thank you. I do have a punch list. Thank you, Madam Chair. I guess this would be for perhaps Ms. Cunningham first. As we are contracting and services are deemed essential or not, are we keeping our public agencies open for permitting and inspection process as it relates to the construction industry?
Right now, from a capital projects perspective, yes, we are. We have some folks, all of our work is being done via telecommuting, WebEx. We have just heard we made contact with all our construction partners that are currently in process, and only 2 have pulled all their staff. So in general, our construction is still moving forward at this point.
Okay, and we plan to keep it going as needed, because I know the
Yes.
construction industry has been deemed essential. So.
Yes, we are.
Okay, I want to get clarity on that. Great, thank you.
Supervisor Patty, if I may, to
Yes.
follow up on that, it's my understanding that community development, although they've limited their access to their lobby, they are taking appointments. They recognize that contractors are still needing to obtain permits and things of that nature.
Excellent. There was a question from some constituents. I'm on the board of directors for the Stockton Builders Exchange as well. So they were asking. Ms. Cunningham, you had mentioned information sharing, and it's a myriad of, it's multi-layered, I believe, because there's levels of information that isn't able to be shared, and I wonder if we've gotten clarity. I did speak to Dr. Park yesterday. We've had a couple of recent issues in one of my cities, Manteca, where information isn't shared about where the virus might be or possible exposures. So what are we doing? What's changed? And what's our practice currently, or what's it evolving to be as it relates to sharing information on where the virus is active?
Chair Miller, Supervisor Patty, Dan Birch, Director of Emergency Medical Services for the county. I'd like to be able to answer that question. I think probably the most knowledgeable of that, Supervisor. So what the EMS agency has done to assist our first responder community working with Public Health Services is Public Health Services shares with us each of the positive lab results for our patients in the county. We cross-reference that with the electronic patient care records that are completed by the pre-hospital personnel. And then we're doing a notification to those individual agencies if they have potential exposure with a COVID patient, so they know that after the fact. Prior to that, though, we've issued very direct guidance to the pre-hospital care community on the appropriate level of personal protective equipment that they should all be wearing. And Dr. Schaefer has been very active. We're probably issuing guidance daily, or it's changing daily on a daily basis, to one aspect of the EMS system or another. This has been a very contentious area of concern for the first responder community, and we've been trying to address their concerns as this situation evolves. We issued our first guidance on January 27th to the first responders on how to approach patients during this pandemic. We've updated that guidance multiple times. On March 3rd, we had issued guidance to all the first responders in our community to don personal protective equipment for any respiratory illness call that they respond to. The call in Manteca, which I believe that you may be referencing with the Manteca City Fire Department, occurred on March 12th. It was for a patient with they were dispatched to a patient with respiratory difficulty. If they had followed Dr. Schaefer's guidance, they would have been properly prepared to treat that patient and limit their exposure and make them very, very low risk. We've researched that case. We've looked at those EPCRs. Neither the Manteca District Ambulance Service nor the Manteca City Fire Department properly documented the level of PPE their crews used on that call. Therefore, we cannot determine their level of exposure on that call because they did not follow existing documentation standards.
To that point, and I appreciate what you've shared, I was told that, we were not screening what the nature of the call would be. So there was a request, and I'm told, this is what I'm told, I am not part of this network at the call center, but I'm told that San Joaquin County is perhaps the only county that was not screening what the call and process of the nature of the call would be. If it was a broken leg or if it was a respiratory issue, if somebody had a flu or a cold, we were not asking that question. And the same call center was in fact asking the questions for Stanislaus. So while we were causing what I'm told was confusion during the call screening process, for some reason we were not following a protocol that would maybe alert the first responders to the nature of the service call. Do you have any information on this?
Yes, sir. So our approach, Dr. Schaefer's approach, as informed by public health and others, is we took through an abundance of caution very early in the process and directed everybody on all respiratory illness calls, regardless of how the patient came in, to use proper PPE. And that goes back to January 27th. The call screening that you're referencing that a lot of the fire service was demanding that we do was for patient tracking who had come from hotspot areas such as the Wuhan province in China. We didn't feel that we needed to do call tracking in the EMD call center for those because we are already advising our personnel to assume that we had community transmission in our community and not to rely on travel history. So Dr. Schaefer took a very cautious approach in order to try to protect our first responders early. With that, just on Saturday, we reached out to Dr. Schaefer and Dr. Kahn, myself, and Lance Doyle, my counterpart in Stanislaus County, got together with our dispatch center that we share to see if we could coordinate our approach for call screening. We came up to a standardized process that we put in place on Saturday night. It was up and running on Sunday and Monday, and we notified our community, and they notified their community yesterday what that new process was. What we're doing is our standard emergency medical dispatch protocol call screening. What we've added is on every type of patient presentation, we'll do initial call screening first. If it is an echo or a delta response, they'll complete that response. Those are the highest level calls that we have. An echo is a cardiac arrest or a respiratory arrest. So we want to get those resources out early. If at that time, if it is not an echo or a delta, or after they've reached it and dispatched the call taker will ask 4 questions. Those include, are you COVID positive? Are you a person under suspicion? Have you been exposed to a COVID positive patient? Or do you have flu-like symptoms, fever or cough, essentially? If any of those are yes, or during call taking, because normally a call comes in and the first thing they ask is, tell me what happened. If they obviously answer one of those in the tell me what happened scenario, then they don't have to ask those questions. If any of those are answered yes, any, then a note goes to all the responding agencies to use special medical precautions. And that really doesn't need to be sent. It helps them alleviate their concerns. But the reality is, if they're following the guidance already, they'll be properly protected when they reach those patients. But we've added that because there was a heightened sense of desire amongst our first responder communities to have that particular information. Our concern is this: by giving them that information, will they lower their threshold and not use the PPE they're directed to use? That's why we were reluctant to ask those questions from the beginning. However, we're going to work with our first responders and our ambulance providers, and hopefully they do follow Dr. Park, Dr. Schaefer, and the medical community's advice on how to protect themselves and others. The other point I'd like to make on this particular subject is the governor's order in our direction, and we've issued directives to the pre-hospital care community on how to report to work, how to self-monitor, don't come into work if you're sick. But if you are exposed, the governor's order says that healthcare workers are essential and should be at work unless they are symptomatic. The CDC recommendations are for a healthcare worker, which pre-hospital care personnel are. If you are exposed and you're asymptomatic, you may still work. You should work because we need you. But the guidance is for the next 14 days from the date of exposure, not the date of notification, but the date the contact happened, you're to work, self-monitor with daily checks for fever, cough, and wear a simple mask to protect you, your coworkers, and patients. And then, only then, if you become symptomatic within those 14 days, should you be removed from the work environment. Right now, we have our first responders acting irrationally and not following medical direction. And they're self-quarantining above and beyond what the governor has ordered first responders in the state to do.
Understood. Question for you. When it comes to PPE, is there an adequate supply? In a phone conversation I had is that if they were put on protective gear for every single call they make, and multitudes of calls all day long, they'd be within 1 week, it was the number I was told, they'd be out of and they'd have no more gear, protective gear.
Right now, we have a very robust logistics base working out of our EMS classroom. We've had 2 shipments, 1 delivered to us, and we're now in the process of going and picking up supplies directly in Sacramento, which expedites our ability to deliver and receive supplies by 3 days. We're cutting 3 days off our availability time. We're pushing those supplies out through the chain. But we only augment the current procurement line. We don't replace it. We cannot replace a healthcare facility's ability to acquire their own supplies. We can only augment their ability. So if a fire department, hospital, clinic, skilled nursing facility, they still have to ask and try to order those supplies through their normal vendors if possible. We're only there to supplement. The guidance that we've been given from the governor's office through the Office of Emergency Services and CDPH is to prioritize those supplies into the hands of people providing direct patient care. Our number 1 priority is our 7 functioning hospitals. And those are ones we're trying to meet. But we're also trying to get as much of the supply out as we possibly can to everybody else in the community. We've probably processed in the hundreds of resource requests since we started last week, and we're essentially operating on a 24-hour or on a 7-day-a-week basis. We've expanded our office hours to be open 7 in the morning to 6 at night. We're going through a lot of overtime. And we're trying to track as many of those hours as we possibly can to get those works out. We worked all day Saturday to catch up with the resource processing. Yesterday, working with the Office of Emergency Services, we expanded staff. We now have, from Fleet Services, we have panel vans that we can use. We now have delivery drivers. We have forklift drivers to help move us the supplies. We've asked for available office workers to help us enter and track those resource requests so we can process them more efficiently and get them out to the people that need them. And we're actively working to do that as quickly as we possibly can.
Just for a point of clarity, let's say, God forbid, somebody falls down a staircase, has a broken leg, has an emergency service call, and we are doing that additional screening process. Do you have a flu or cold or coughing, sneezing, temperature? We're doing that screening process now. They do not have to show up wearing protective gear at that level, do they?
They always have to have their protective gear. Right now, every person who arrives on scene should have gloves, face shield or goggles on for eye protection, and either a simple mask or an N95 respirator on every patient contact. That is the direction that we've been given to all of the pre-hospital care personnel right now.
But that could be a catch-22 if they don't have an ample supply of that gear.
And yes.
Yeah, okay, understood. And it's a shortage everywhere. It's not...
There's a shortage everywhere. We had a very productive healthcare leadership meeting prior to today's board meeting that Director Dieterich led with all the divisions. We're trying to coordinate as best we can amongst each other and as a coordinated approach for the county on how we approach this pandemic, trying to build relationships even tighter between ourselves and public health and our other healthcare partners to do that. I know there's several questions about what we're doing at the hospitals. We're doing daily hospital status reports with our hospitals. Without St. Joseph's Hospital reporting, they didn't report today. We have 17 ICU beds available in the community, and we have 62 ventilators available in the community. And that's with our largest hospital not reporting. So I think we're doing okay from that perspective. Dr. Park and I are working to to schedule a meeting tomorrow with the hospital executives and their chief medical officers to brief them on the current situation and to try to get them to do advanced planning with us. We're trying to stand up our advanced planning so we can prepare for not just for tomorrow, but the week and the week after. We have an existing pre-hospital care or a hospital surge plan. That is the medical health operational area coordinator. I issued a directive today to the hospitals that they must implement. We have 750 portable medical beds at our office. Some have already been deployed. I want every one of them pre-deployed to hospitals by no later than end of Friday this week. And I want them to actively being engaged with us to start expanding capacity and thinking not tomorrow, but 2, 3, 4, 5 weeks down the road.
Thank you. I appreciate that. I want to go back to my information sharing part. Through the chair, I'd like to ask County Council. Last week it had come up that there are some counties that are sharing information, location where outbreaks are, and we were not. There seemed to be a legal limitation on releasing where the virus might be active. And speaking with Dr. Park yesterday, she felt that the number of positives increasing as it has may now trigger or warrant sharing where the virus is located in and around San Joaquin County. Have we cleared that hurdle, and what's the process or plan for informing the public?
I can't speak to the process of informing the public. I imagine that would come through the Joint Information Center as far as sharing that information. I believe that there is guidance from the state to the public health officials on how to report information, not going down to, my understanding is, if in the using city limits, for instance, that what should be reported if it's 4 or less incidents that are in that location, we just report that there are 3 or I believe it's 3 or less. Is that correct, Dr. Park?
Let me explain to the best of my ability. So last week when I stood before you, our count was at 13, and I didn't feel it was proper to start releasing the numbers by city, and I will explain that. There is a health and safety code 120175.5 that says that a health officer shall make locations known to government entities in the midst of a communicable disease outbreak. This wasn't clear to me, as it says that release of information is to government entities, not to the public. And my choice was not to release just to government agencies, but to simultaneously make the availability to the public if I was going to do that. There is also a health officer practice guide for communicable disease control in California, and I looked up the laws there. And this guide does recommend that I practice caution and that I balance people's right to privacy and their HIPAA rules with the community's need to know in the time of a communicable disease outbreak. And as part of following this guide, the question is to what is the size of our community, because the size matters. This is also guidance that I've been looking up through NACHO, the National Association of City and County Health Officers, and so there's a lot of different guidance out there. And so what is the size of our community? We have a county of about 750,000 residents. And based upon that, there are data suppression laws that come from the California Department of Health. And with the data suppression laws, it's actually a very complicated way of doing mathematics, and there are calculations involved. And as Mr. Miles suggested, there is a number at which you would mask the number of people that one city might have. So, for example, last week I might have had City A with 10 cases. City B had 5 cases, and City C had 3 cases. And if I were to mask at 3, which is the recommendation of my epidemiology team based on these data suppression laws, I would say that City D, E, F, they would all have less than 3, which could mean 0, 1, or 2. And I had to be very careful in deciding whether if you had, let's say, 1 in one city, and that city was small, the law says if that's discoverable by somebody in the public, you must mask the identity as much as possible in order to protect that person's privacy. So let's say you have a very small city and there's only one person positive in that city, and I said it was an 85-year-old male. That might be something that people in that city could figure out and say it's got to be him. And so there's certain laws that tell us at what point in our community do we do data suppression. And so I'm looking for a data suppression with a mark off of 3. And at this point, we are getting to the point where a lot of the cities have broached that number or are approaching that number or are past that number. And so it might be something that I would consider doing, and I am considering it strongly, because at this point, the positive effect for me would be to say, okay, we've got City A with 10, City B with 5, and the rest are at 3. Maybe a couple would be less than 3, and that would be their designated number. But by showing that it's in most areas of our county, it really would perhaps get people to honor the shelter-in-place order more. So that's a positive effect that I see. And so at this point, with the numbers that I'm getting, I'm at the point where I might be able to share information that would be valuable in this sense. The negative effect in the beginning, for example, last week when I didn't have that many approaching that masking number, would have been that City A with 10 cases would be vulnerable to being targeted for blame and stigmatization. And those with very few cases, people would look at that number and get from that a very false sense of security. And that was my concern, is if you have very low numbers, I don't want to give the public this false sense of security that there's no COVID in their town, because the message I really want to be giving to the public is that it can be anywhere. We are not testing enough in this country to pick up everyone who is mildly symptomatic or asymptomatic. We just don't have the capacity. So the message is, if you have that number and you're seeing less than 3, don't assume it's 0. There are positives everywhere, and I really wanted to enforce that message that it can be anywhere, and don't get this false sense of security because the number in the city you happen to be living in is low. So we may be reporting by the end of this week some numbers, and I have to be very careful as I look at them to see what is discoverable. And this will come with a footnote that reminds people that we are masking at 3, and that all of these numbers are based on where people live. It's not necessarily where they contracted the disease. So we can only follow numbers based on your residents. And it might be that some of these people are not even hospitalized here in our county and did not contract it here in our county. So in reality, the numbers are not going to give a perfect sense of where all the COVID is, but it might give an overall sense of where we have clusters. But again, as I said, I don't really want people to think of in terms of any of this being clustered. If there was truly a cluster in any one community, like one street, I would know it, or one block, I would know it, and that's not the case.
Thank you, Dr. Park. And you've very carefully explained there is a pro and a con to doing it, and I can see either case and argument for it. And I'm certain that nobody is interested in the age or the exact location of where an infection might be. It's just a generality. There are websites out there. LA Times had something that, you click on the link and you went to everything in proximity in LA County. It told you how many cases and infections were throughout that county. Without pinpointing and more specific information. The concern, if I'm looking at information that 888-777, well, in my area code 95219, I've gotten no notification in any capacity, so I'm assuming there's absolutely nothing of any importance for me to be aware of. So I would, to your point, not give a false sense of security. I'd be sharing information to all, even if something may not be a red alert, sounding alarms for my particular, zip code. I certainly would be sharing information that, the numbers have just gone up. Today's report is 55 versus yesterday's 41 or 2. That's alarming, even though we're not identifying where it is. That still tells me that it's present, may not be in my front door. I don't want that false sense of security. So I think we're better off with more information to give people heightened awareness and concerns and messaging about good conduct and protocol. And I'm just staying along the same lines of information. I, and as well as the other supervisors, had gotten a letter from Matthew Schaefer from the labor representative from the California nurses, and they're just asking for more information. They've got certain protocols and things they'd like to see, but their big complaint to me in one of the follow-up emails I got is this: they feel as though the nurses have been shut out of a chain of information. So I'm sure you've all gotten this. I'm not looking for answers for anything right now, just that maybe some of their requests could be addressed according to their need for more information and some basic protocol. Let's see, one more thing I had noted, information delay. As we have a stay-at-home requirement, and there's some workers that are being furloughed from the county, through the chair, Ms. Nino, I'd like to ask you, what's our protocol going to be as it relates to salaries or deferred payments or anything? A lot of concerns about that. It's been brought up through public comments, and I'm sure all of us supervisors have had emails to this effect.
Mm-hmm. Supervisor Patty, board members, Madam Chair, we're going to speak to that in some level of detail. We don't have it fully vetted, but we definitely want direction from this board today. And we'll talk about it in regards to this new legislation, this HR, I think it's HR 6201.
All right, thank you very much. Madam Chair, I think that's all I have for now.
Anyone else? Supervisor Elliott?
Thank you. One additional question that's come to mind. Some have asked about whether they can be sure that even takeout food is safe, a takeout restaurant. So the question is there any special action that we should be taking with environmental health, for example, to ensure that our takeout facilities are safe?
We'll let Casey address that question.
Ms. Foley, we're going to keep you working right up to the last minute.
So to address that question, it's been asked a lot, and we have guidance that we're following. Actually, it's on our website now, which is to handle the food with the person delivering should handle the food with gloves when they pick it up and deposit it on the porch, knock on the door. The person will say, leave it on the porch, please, and then they'll step back and let the person get the food because they don't want it stolen. And then they go on their way. And then once the person brings the food in the house, actually they should have gloves on as well, or towels, something. They're not touching it directly. Then when they take the food in, it's recommended that they remove it from all the packaging, dispose of the packaging, put the food in containers, and then wash your hands after touching all the packaging, and then serve the food. That's the recommendation. So that's what we're telling people.
Okay, thank you. So that covers the delivery of the food to a residence, but
The food itself, I'm sorry, I didn't address that.
yeah, the food itself
So,
is.
I can't remember if it was CDC, but it might have been, if it wasn't CDC, then it was California Department of Public Health. They said that it's safe. It's prepared in a restaurant, in a fully regulated restaurant and following all the rules, that it can't be transmitted through food. That there's been no evidence to show that COVID-19 can be transmitted through food. So as long as people are preparing food properly, then it'll be fine.
Okay, so a properly licensed establishment should be fine.
Yes. And to only use a properly licensed establishment. Thank you for that opening.
Thank you.
Okay. Others?
Madam Chair.
That's it.
Madam Chair, sorry. Clerk.
Yes.
I did receive some questions from City of Tracy for clarification on the stay of order, which I don't believe were answered. If I have a moment just to read those questions real quick, and I do apologize if they were answered. This is from Rhodesia Ransom. She asks that the state stay-at-home order is indefinite. However, the county order ends on April 7th, 2020. She is concerned that having this order issued after the state order may confuse county residents. Can we state or until the state order is rescinded in order to clear up confusion? Do you want me to read the other questions as well before answering?
I believe the order does say, unless it's rescinded, amended, changed.
Or extended.
Or extended, correct. So, but her question was, why not make it until
Indefinite.
indefinite? To do that.
If there's a need to amend the order between now and April, that's certainly something that we will look at also, is the expiration date of it.
I know this is changing all the time with the state. I just think as much as possible we should update our language to remain consistent with the state.
And then her second question is, the county order section 11A Roman numeral 7 indicates that residents can leave their homes to attend public and private gatherings with up to 6 non-residents. This seems to be in conflict with the governor's order to stay at home unless you have to go out for essential medical needs, groceries, or essential and or critical infrastructure jobs. The governor's order does not seem to allow the gathering in the county's orders. Can we please clarify?
We'll take a look at that.
Again, this is evolving, so it's my hope that we'll continue to get these updates, and if they need to be ratified by the board, we're going to talk about meeting more often anyways, so that those ought to be able to be ratified in a timely fashion.
And then third, she just states that she would additionally ask that we clarify the difference with how we are choosing to handle homeless versus the state orders. That's it.
Could you repeat that, please?
Her last comment is, I would additionally ask that you clarify the difference with how we are choosing to handle homeless versus the state orders. And that's all that she wrote, so I can't comment further.
Okay. Can clarify that information that's being posted. It was my understanding from Mr. Woods that we're very much remaining in alignment. Also from Mr. Cheshire, we're remaining in alignment with the state. And in fact, we've had to kind of scramble around a bit as the state has changed their thinking. We've had to scramble to revise our approach, but that we are remaining consistent with the state. But maybe what we need is to just make the information a little more clear on our web pages. That is what we're doing. Is that it? Okay, great. Thank you very much for another very good update. All very much appreciated. Okay, the next item is resolution regarding limitation on residential and commercial evictions. County Council is going to handle that one.
Thank you, Chair Miller. Through the board, as part of the state's addressing the COVID crisis, last week, the governor issued Executive Order number 2820, which authorizes local agencies, counties, and cities to adopt by resolution or ordinance and place limitations on evictions that are the result of COVID activities. But it does require the action at the county level or at the state level, or at the city level in order to take that. So what I have brought before you for your consideration is a resolution that will suspend the authority for landlords to commence evictions both on residential and commercial properties. This resolution is specific through May 31st of 2020 because that's what the governor's executive order said. The main provision of it is that it limits the ability to pursue that eviction if the eviction is premised on non-payment of rent or foreclosure arising out of a substantial decrease in household or business income, including but not limited to substantial increase in household income caused by layoffs or reduction in number of compensated hours, or substantial decrease in business income caused by reduction in operating hours, or substantial out-of-pocket medical expenses, and the decrease in household or business income is caused by the COVID-19 pandemic or any state, local, or federal government response, and is therefore documented. I understand that the sheriff has already indicated, and I saw a press release to the effect that he's not handling evictions at this point. And what this will do is it provides a defense, two parts of it. One, it says you can't proceed with an eviction. And then if when the courts open back up, somebody does file an eviction, the tenant, if they're able to show that their inability to pay the rent was caused by COVID and they meet those parameters, then it's a defense. The resolution that's before you, the same as the executive order, does not relieve anybody of their responsibility to pay rent. So they're still going to have to work out some arrangement with their landlord to come current on the rent. And it does not prevent a landlord from ultimately recovering rent or ultimately recovering their property at some point. But I think the last thing that the board wants to do at this point is to have either businesses that are pushed out from their place where they're operating because of COVID, or to have individuals pushed out and then we increase the homeless or near homeless. So this is a temporary action that will, as it stands now, will carry through the end of May, but may require an extension.
Questions? Supervisor Wynn?
I understand the premise of this, I guess, and you probably don't know, but I'm assuming that the documentation that connects the eviction notice with the COVID virus would be entered into evidence at whatever action was taken by the court?
That is what I would expect, yes.
Because I know that some property owners would be concerned in regards to them just using this as a tool to extend, whatever. So.
Correct. I mean, there's absolutely that risk out there. But I wanted to provide the board with the opportunity, should you choose to enact the resolution instead of just holding it back.
Yeah, thank you.
I think this is something sort of along the lines that I spoke about earlier in terms of prevention for additional homelessness. And this is premature now, but as we go forward with this and we start to see how many folks in the unincorporated area can prove that their delay was through COVID-19, I think the county needs to be diligent in looking at and pursuing additional programs that might be available to help relieve this. Because some people who are $400 away from an emergency, they're not going to be able to come up with a payment plan that's going to satisfy landlords. They're not going to be able to reimburse them quickly enough if they're out of work for 4 months or something. So I think we need to be aware of this and be looking at it proactively, pursuing whatever programs, pursue it legislatively. But this is, I think, relief that's going to need, that the public's going to need in the future as this crisis begins to wind down, but we start to try to get back to normal. I think we need to pay attention to this, because otherwise we are going to end up with a lot of businesses closed down that aren't going to be able to participate in a recovery, and we are going to end up with more people out on the streets. So I just think going forward, we need to really be taking a look at this and planning for it, because I think it's definitely going to hit. Not all these folks are going to be able to get current.
And as a point of clarification, Supervisor Miller, because this is an action exercising the police powers of the county in conjunction with the emergency, this resolution is effective countywide.
Okay.
It is not
just the unincorporated
area.
Great. Thank you very much for that clarification. Any other questions? Supervisor Elliott.
Thank you. This question is somewhat related to this particular issue, although not directly to this particular action. But I've also had a request here to think about, at least, a delay in the deadline for payment of property taxes. And it relates to this somewhat, in that if property owners are going to be prohibited from pursuing eviction notices in order to get someone who can pay the rent, or these other actions that we're taking here to alleviate some of the other problems related to homelessness, etc. But then it creates a difficulty for those who then have to pay their property taxes, and the way they can pay their property taxes is through the income that they receive from their property. Could you comment on whether we have any basis for delaying the deadline for businesses to pay their property taxes, or individuals?
Yes, Supervisor Elliott, through the chair. I know that is a request that's been made by all of the counties to the state to address those deadlines for payment of property taxes, but that is not an authority that rests at the county level to delay those actions. That rests exclusively at the state, and so far we have not seen any action from the state to give that relief.
But we have relayed that request.
Yes, I have seen correspondence to the state asking for that, yes.
Thank you.
Supervisor Elliott, if I could also add, Madam Chair, I've seen a recent letter from the Treasurers Association, so I'm not sure if our treasurer is anywhere close, along with a few other associations that are advocating against it, because their argument, and this is me scanning this letter very rapidly, because they distribute the property tax, there's certain deadline, and of course, as a lot of us are well aware, a lot of our local property taxes go to the schools. And so that was a big part of their argument in the letter. But possibly, hopefully, our treasurer tax collector is listening, and he could at least explain why they're of that position rather than delaying the deadline. And who knows if their position has even changed. So I'll see if my staff can reach out to him and before this meeting ends, so at least the board could hear that perspective. But I saw that, I want to say, either the end of this week or the first part of this end of last week or the first part of this week. I saw that letter. I received a copy of it where they were against delaying the against delaying the payment.
I see someone racing into the chambers.
Thank
I'm
you,
assuming
Jolena.
with information on this.
There have been a lot of calls on this issue. CSAC and the other associations, as well as the Treasurer Tax Collection Association, are advocating against that, only because there's a lot of interactions with the county property tax. You have that in your mortgage. A lot of people, a lot of companies are involved in that, have it automatically paid in their mortgage. So there's a lot of interactions. And then you have a lot of, excuse me. Whew.
I know you actually were running into the chamber.
So there's this concern that, and notice the property taxes also pay schools and special districts. Yes. And so I can send you all the memos I've received from the county treasurers and tax collectors and CSAC, and they've all on a joint letter. I can send that to the board members so you can see why, as a county, and even a lot of the CEOs were on a call saying, Los Angeles, all the big counties were saying, we want to hold the line and not move that deadline because it is important for all of because if we don't have the money, how are we going to continue to operate and provide those services? Right. At the bottom line.
Thank you. Supervisor Patty.
Thank you, Madam Chair. A quick follow-up to that. If we are to follow recommendations of not delaying the collection, is there any wiggle room to delay any penalties?
So, and Jolene, so they did address that. It looks like that's probably the largest piece that they are trying to accommodate, is to relieve any interest and penalties, which are significant. Go ahead, Ms.
I believe
Moore.
you can, up to treasurer tax collector, you can waive penalties, but I can certainly, I'm not a lawyer, but maybe Mr. Miles can address that, but I can certainly get back to you on that point, because I think that was discussed in the letter and the communication, but the legislature is on recess until April 13th, and that probably is going to get extended, so I don't believe they're going to do anything on the county property tax side, but I will look into the waiving, but I believe that is also an option, yes.
Thank you. And just a quick follow-up through the chair. County council, is that a local jurisdiction?
Yes, my understanding is that the treasurer tax collector has that authority to waive the penalty.
Okay. At the direction of the board or independently?
I will have to check on that.
Thank you.
Thank you. Okay.
Chair Miller, I did receive a request from Mr. Balaji that this resolution be modified to extend authority for the county not to shut off water for non-payment of service charges as well. And if the board is agreeable with that, we'll amend the resolution to.
How does the board feel about that? Supervisor Pudwa?
No problem with it.
Good.
Aye. Okay.
Yeah, I agree. So we will amend this. So any motion to approve will include that amendment. No water shutoffs. Okay, if there are no more questions, then I am looking for a motion.
So moved.
We have a motion and a second. Please cast your votes. And that is approved 5-0. Thank you. Okay. Next up, do you want to?
I know.
Do you want to insert now this additional item, County Council, or do you want to wait until after the next two discussion items?
Board's pleasure.
Pleasure of the board. It has to do with this topic.
It does.
Let's stay on topic then. Let's go ahead.
The board has authority under Government Code 54954.2 to allow matters to be added to the agenda if there's an immediate need to address the matter and the matter came to the attention of the board after the agenda was posted. H.R. 6201 was signed into law last week before the agenda was posted, but the language in it specifically states that sections that would affect the county do not become effective not later than 15 days after the enactment, which left everybody going, well, I guess we're doing nothing until sometime early April, April 2nd, April 5th, depending on when you're counting from. On Friday, though, the Department of Labor and the Department of the Treasury issued directives saying that 6201 was effective immediately. So that's how it came to our attention that we needed to have this discussion right away rather than in April. So the first thing that I would ask is for a motion and a vote to add a discussion of HR 6201 and the implementation of it to the agenda.
Okay.
Madam Chair, I'll make that motion to add, what is it, 62?
HR 6201.
HR 6201.
I'll second the motion.
We have a motion and a second. Please cast your votes. That's approved 5-0. Onward.
Thank you. We didn't have much of an opportunity to discuss this before the meeting. If Ms. Hopkins, if you like, I'll address the health workers.
That would be great. Thank you.
Great. The two provisions that are under 6201 that are pertinent to the county. First off, 6201 requires every employer to provide up to 80 hours of sick leave to its employees. It's COVID-related sick leave, and there are it's to provide if you need to provide off for your child care because the schools are closed, if you are sick, or also it applies if you're not able to work because your agency or your business is shut down. So all employers are required to provide those 80 hours of leave. One of the issues, though, is that specifically within the law, it allows the board or the local agency, it allows the employer to exempt healthcare workers and first responders from that 80-hour leave bank. The idea of that is not to punish healthcare workers or first responders, but the idea is that they are immediately necessary to continue to respond to the pandemic. In looking at the legislation and in looking at the issues that we know that some of the healthcare centers in our county family have faced, a healthcare worker might show up with a note from their family physician that says, this employee, I'm recommending that they stay home. You heard Mr. Birch speak a few minutes ago about what the CDC recommendations are for healthcare workers is that they're supposed to stay at work until they're symptomatic. I know that the hospital has set up a COVID clinic for its employees, and so they have physicians that are aware of the CDC recommendations and how giving sick leave notes to employees will impact their operation. So one of the things that we're recommending and that we'll ask that you act on is authorize the county administrator in coordination with HR, healthcare services, and the hospital to restrict providing those 80 hours to healthcare and first responder employees unless they go through the county's COVID clinics. If they go to the COVID clinics and they get our physicians are saying, yes, you need to be home, we'll provide them with those 80 hours of leave. But otherwise, it wouldn't be available to them. We need. I'll turn it over, unless you have questions on that particular part. Ms. Hopkins, I know, has additional parts she wishes to discuss.
I have a general question. Governor Cuomo this morning was talking about one of the actions they're taking is they're hiring retired staff and personnel, people that obviously are qualified, certified, and experienced. Are we doing anything of that nature in San Joaquin County, as we have many retired personnel that could be eligible to help out and relieve that workload of our healthcare providers?
I can speak to that a little bit. So good afternoon, Chair Miller and the board. There has been a change to CalPERS that allows some restrictions for retirees. As this board knows, currently if a retiree retires and we want to bring that individual back, we need to come to the board in open session, do a presentation for up to 6 months, and then there are some hours requirements of how many hours a retired annuitant can work in a year. The state has lifted those for CalPERS. There is some indication that those will also be lifted for 1937 acts. We are working with SJ Sarah and County Council to determine if that is something that we'll be able to implement, and we should have that information shortly.
Okay, thank you.
I know that there's also, I'm sorry.
Go ahead. No, go ahead.
I know that there's also been communication with some of the staffing vendors for the hospital, and because of demand nationwide, the prices increased dramatically.
I believe Mr. Dietrich, they're currently doing quite a bit of that out at Public Health right now. So I think he could provide a lot of details because it's been extremely helpful.
Yeah, so outside of the 6 month as an annuitant, we have hired several microbiologists for our public health lab, such that we can stand it up 7 days a week and continue to provide the lab testing services we have. And I know we are also reaching out to other retired public health staff that are beyond that 6 month separation window to see how we can supplement our staff with them.
Okay, we're going to turn it over to you.
Thank you. I can provide a brief overview of HR, get the acronym correctly, 6201. It has two components. One is the FMLA Public Emergency Leave Act, and this helps employees who need to be off work or are unable to telework. Both acts encourage telework where telework is available to care for a child or a family member. Both of these run concurrent with the current Family Medical Leave Act, otherwise known as FMLA. So there's a lot of nuances that we're working through to make sure that these things are available to employees. There's also two different pay scales. For the FMLA Public Health Emergency Leave, we're looking at 2/3 of the employee's pay. They can supplement with accruals, vacation, sick, administrative leave, things that the county already provides. The one that County Council is that we are focusing on for our healthcare workers and our first responders is the emergency paid sick leave. This also affects the rest of the workforce. It's the 80 hours, as County Council mentioned, and it's prorated for part-time employees. So that's important for our organization to understand. That is the eligibility requirements. It also applies to part-timers. There are no eligibility requirements, and the employees are eligible upon hire, and this needs to be used first. So this is our first gap measure for individuals who are unable to come to work or telework because either they are experiencing symptoms, they are seeking a diagnosis, or they are helping an individual such as a child or a family member who has experiencing symptoms or has seeking a diagnosis, needs to be home for self-quarantine, for example, those types of things. So this is really, as I mentioned, our first stopgap measure, the 80 hours available for full-time employees. And depending on how the individual is affected, if the employee is in self-quarantine, for example, it's at 100% of the employee's regular rate of pay. If it's for a family member, let's say I was at home and I wasn't able to telework to take care of my child, it's at 2/3 of the rate of pay. So this is what we're looking at for the general workforce as it was implemented by the president earlier mid last week. As County Council mentioned, initially we thought we had about 15 days to implement, and that was really to allow us to get the payroll processing piece up and running. That is now effective immediately, so we will be working to get that set up immediately. Human Resources is working with County Council and Auditor Controller Payroll to make sure that this is available for all employees as needed and necessary.
Questions? I have a question. How come only 2/3 of somebody has to stay home because of a child? I mean, their household expenses are certainly just as important to be able to meet them as someone who's on their own.
Chair Miller, I think that's an excellent question. I have not seen anything in any of the information I've read, and we'll defer to CAO Monica and County Council in case they have. But even in the County Personnel Administrators Association, we haven't seen any real distinction as to why that was implemented.
Yeah. There has not been any follow-up of why that distinguishing factor was made. But it doesn't mean that this board, if they want us to implement it, could essentially add the additional third.
I personally, I have a problem with that. I mean, you've got a lot of employees who are sole breadwinners for their families, and if they have to be at home because of a child, to me, it doesn't feel right that they should be penalized.
It does extend for 12 weeks. So that is one difference between the 80-hour leave bank and the 2/3 for the paid family medical leave, is that it does provide it for 12 weeks.
Question. Madam Chair. Yeah, thank you, Madam Chair. So, if I'm understanding correctly, as noted by County Council, we've got one provision that's 80 hours, that's 2 weeks.
That's correct.
Of full pay, or 2/3 pay for up to, what was it?
12 weeks. 12 weeks.
Up to 12 weeks. So the person that's getting full pay, that would expire after 80 hours,
yes,
and they would go to a 2/3 scale?
If they were off for one of the reasons that are set out in the family medical leave, yes, they would go to the 2/3.
Okay, I agree with Chair Miller. It's troublesome. There's not a lot of agencies or transactions we do in the county that generates income. We receive income from our tax base and a lot of the supplemental funding that comes through the state or federal. I'm not sure if I'm in favor of cutting back and reducing what our employees are receiving when it's not that they're not generating income. They're sent home with no fault of their own, but the county is still going to be receiving the pass-through income from state, federal, or from our tax revenues, unless there's something else that I'm unaware of. But County Council, Ms. Nino, our CAO, would you shed some light on where I'm thinking here?
So just to provide some additional clarity, as we are going down to essential services, this board, every year as part of the budget process, determines county fees. So there is going to be less revenue generated. Over the weekend, this board was informed our airport business is going down. So there are other things besides our local, state, and federal revenues, along with our local property tax dollars. Because as we all know, we receive out of every property tax dollar only roughly 18 to 19 cents of that dollar. So I would say predominantly, we will receive a big portion of our revenues, but there will be a significant portion which we relate to as departmental revenues, which are very fee generated. That is going to diminish to a certain extent.
What would you put that number at? If we looked at all of the totality of our fees, are we in the 80 million, 20 million, 17 million, 6 million, 1 million? What would you think that to be?
You know what? I wish
I'd be on the spot here.
Hey, that's okay. That's part of my role. You know what? I can't give you an exact dollar amount. I do not know that. It's significant though. It is significant. So what number I do know, of our total revenues, primarily you guys often our board members hear about general purpose revenues. That's roughly, and this is an estimate, over $270, $280 million annually. That does not include any departmental revenues. Then we have a big portion, and I want to say it's over 50% of our $1.8 billion budget. More than half of that relates to state and federal revenue. So you take off the top of that 1.8 billion, and I'm just kind of doing this math out loud, take off the roughly half of that. So say roughly 900 million relates to state and federal revenues. Another 270 million relates to, so you're up to about 1.3. I would guess that we're probably at least, 300 million in fee generated revenue. It might even be higher than that, but that's me, Supervisor Patty, taking a guess and trying to do the math backwards.
That would include our local property taxes of the 300 million?
That would not. That's why I brought up the general purpose revenue includes our local property taxes. And roughly of that, say 270 million in general purpose, I believe like 80% relates to property taxes, which is our largest. I think that might be like 230 million. I'm going to be so proud of myself if I'm guessing really close, because that's, I'm the ultimate competitor. Roughly 230 million, roughly property taxes, probably another, say, 22 to 25 million, maybe even 27 million is sales tax. So out of that roughly 270 million, the bulk of it is property taxes, but I'm talking take that away, assume we continue to get it. So that's why I said roughly about, I'd say like $1.3 million, $1.4 million state and federal revenue, local sales tax, local property taxes. As we know, there's been major buying surges at our grocery stores, but have we thought about all that industry that we may not be getting local property taxes as a result of our stay-at-home order? So I think to a certain extent our sales tax were diminished, but the other piece, so take the roughly 900 million in state and federal revenue. That includes, because our two largest departments are human services and our hospital. They have a lot of state and federal revenue. Take our general purpose revenue, another 270 million. You're up at about 1.1, 1.2 billion. And so that's why I'm saying maybe 300 million at least relate to fees that are generated. Good example, community development. Big fee generator when it comes to the permits and activities that they do. Environmental health, they're very fee generated. So you have significant departments that have, million plus. Community development, we're probably in the 11 million range. That probably their fees, I'll bet you at least probably bring in at least 3 million for them off the top. So I would think
those departments are still open.
They are, but yet they're appointment only. So both public works and community development are appointment only. So I would anticipate since we are, good example, say our landfills. I know we're reducing activities there at the landfill. That's an enterprise fund. I know we're in decent shape from a reserve perspective. So the risk I believe the county has from going down to essential services is the reduction on fee revenue. Secondarily is the utilization of reserves. This board has been very conscientious to set aside appropriations for contingency reserve, roughly 90 million, 5% of our $1.8 billion budget. I will be shocked if we're not having to dive deep into those as a result of closing out our books, along with balancing next year's budget. So that's my only caution that I give to this board about, okay, we are going to have a level of diminishing. It won't be half of our revenue, but there will be, I believe departments will either be in a situation where they're having to barely make the need of their status quo as a result of the reduced revenue.
May I add something relative to the 2/3?
Yes.
While I personally may not know the exact reasons that was implemented, I also think it's important to remember that as a public sector employee, let me back that up, that the legislation also allows for employees to supplement with their accruals. So I mentioned earlier their sick leave, their vacation leave, admin leave, whatever they've saved up. So that is one way for the employee to still make it to the 100%. And compared to some private sector organizations, most public sector organizations have very generous sick leave. Banks, for example, we accrue 96 hours of sick per year, and as long as the individual's still in paid status, they're still accruing, which would help them to make up their gap. There may be additional resources through EDD and others that allow employees, we're still trying to understand all of that, where they may also be able to do some supplemental income.
Okay. I guess I would just feel more comfortable if this was applied equally to our employees. So if it's 80 hours and then everybody drops to 2/3 for Family Leave Act, it just doesn't seem fair to me that if you have children, your income immediately drops. So I don't know how we can look at that. I'm not sure that everyone then is eligible for those 12 weeks. But if they are, but their first 2 are at 100%, it seems like the folks that have kids ought to be on that same playing field.
Supervisor Miller, there is, under the 80-hour, the Emergency Paid Sick Leave Act, that does include the employee is caring for a son or daughter if the school or place of care has been closed or the child care provider is unavailable due to COVID-19 precautions. So that initial 80 hours is available even for if the reason you're not working is because your child's school is closed.
Okay. As long as it's applied fairly, and I would also say to really keep the board apprised on this, because I realize that we are very conservative and very protective of our reserves, and we need to be to make sure that essential services continue to be delivered. But there's a reason why it's called a contingency reserve, and this is about the biggest contingency I think anybody's going to see in their lifetime. So I don't want to push too much onto our employees too early and in an unfair way. And I think we should continue having these discussions so that the board is very aware of exactly where we're at and what the future needs may be for those reserves, how our revenues are looking. I mean, we've just heard over a 4-day period over this weekend, the rules changed about 5 different times. So I would like us to stay on top of this, because I don't want to unfairly increase the stress. And I also do think we should be looking at some way of our employees who are deemed essential and are showing up and coming into work. There should be some way of rewarding them for continuing to do this, whether it's additional accrued leave that they can't take until all the declarations are removed, whatever we come up with. But I do think there should be a way of making sure that our employees who are coming in under a great deal of stress, not only about their own health, but their families, I think we need to send a strong message to our employees that there is going to be a recognition for this above and beyond responsibilities.
We'll formulate some options and share them with the CAO's office and County Council to bring back to you.
Madam Chair and board members, is this board comfortable with us implementing HR 6201 as it's currently stated? Because that's the direction we need today. Because we'd like to get that out to department heads and employees so that we could accommodate. Because some of our employees are on their current leaves and they're utilizing their own time right now.
Do you want direction or do you need a motion?
Can we get a motion, Mark?
Yes, I think we need a motion, especially on the on how we deal with the healthcare and first responders.
Can I speak real fast?
Yes, Supervisor Villapudua.
Thank you, Madam Chair. Just curious, how are other counties staying home their non-essential employees, and are they using their sick leave, and how does that work on other counties? I know other counties, I'm getting emails from employees throughout the county saying, non-essential employees should be able to go home. So how are other counties putting up with that?
Looking for my notes. I have been monitoring closely with the Personnel Directors Association up and down the state. And as we've talked a lot this morning, it's fluid. So what I say right now may not be the same when I get back to my desk. There is a variety of counties that are using some form of paid administrative leave right now. I think that's probably what the board has received the most comments from our employees about. but I think it's probably a good thing to note that probably about a little over 15 to 16 counties really have been looking at advanced leave accrual programs. So crediting employees, maybe a COVID leave bank, for example, I've seen anywhere from a low of about 40 hours to a high of 96 hours, which is the 1 year, advancing 1 year of sick leave accruals, which is essentially allowing employees who run out of time to go negative. They would need to pay back that time depending on the county over a period of time. Stanislaus in particular is front-loading the 96 hours that I mentioned and then just turning off the sick leave accruals for the next fiscal year to make up that time. So there's a variety of options out there. Most counties have been leaning towards this advanced leave accrual bank type situation.
Which would be costs, Supervisor Villapudua, that the county would have already incurred anyway if those employees remained employed through the following 12 months.
Well, the only reason it makes sense right now is because I think that just the non-essential employees coming to work, there's the chance of spreading the virus. And I think right now it's a critical time to, if you don't have to come to work for non-essential, I think you should stay home. So that makes sense to me. If we were to give them an extended time of like a credit of some sort of sick leave, it just makes sense to me.
And every county that has responded is doing and following similar to CAO Nino's direction to look at telework. So most counties are looking at telework first, and then being off using now the emergency sick leave or the advanced accrual banks or individuals' own sick leave, vacation leave, compensatory time, whatever they have on the books.
Yeah, I agree with Supervisor Villapudua. I think if employees aren't essential, I realize all of our employees are disaster relief workers and as such can be called back, but if they're not actually required to be there, we should be looking at how can they work from home, and if that's not possible, then we need to figure this out so that they can stay home and not. It also allows the folks that are essential, that are still here, to maintain that social distancing because it's not so crowded. So I think we need to work through this, and I know we are. I know our departments are going through each one of their departments, and we have a tremendous amount of employees. We're the largest employer. I understand that, but I do think we need to figure this out as quickly as possible. Supervisor Wynn?
Yeah, as Supervisor Villapudua asked, I'm curious also, in the regular MOUs for an employee who has a sick child, what are they entitled to?
In the majority of San Joaquin County's MOUs, they are entitled to use between 64 and 80 hours of sick leave per year to care for a family member. I think CAO Monica, or Ms. Nino, and I agree, we would like to make a recommendation to lift those requirements at least until the end of this fiscal year. They're counted on a fiscal year basis. That was one of the recommendations that we wanted to bring forward.
Okay, so employees already have, aside from the COVID, they already have the opportunity to stay with a sick child for whatever reason. That's already in place.
64 to 80 hours.
Okay, and it's their credits that they've accrued.
Correct.
Okay, the second part is in regards to having employees stay home. We really haven't heard a lot about what departments are doing. I know there's a lot of creativity out there. But I guess the question, so we have the one where currently an employee can take, I assume, sick leave, time off to care for an ill child or family member, correct? Okay, then we have employees who obviously, who come to work as has been stated earlier, and so they're obviously getting paid. And then we have employees who are going to be telecommuting or working, at home, and I assume with the same essential workload thereabouts that somebody would be doing at the workplace. So those two are taken care of, and they're continuing to get full pay. So the question arises is especially in light of what's been said by our public health and obviously other experts, one of the things we want to do is reduce the amount of contact between human beings, obviously be in the workplace. So are we currently, let me leave that on. So then also we have the opportunity to tell employees not to come to work because they're non-essential. Is that correct?
That is correct.
Okay, so have we decided, as was questioned earlier, are they getting paid or not getting paid, or is that a decision that needs to be made in the future?
Madam Chair, board members, that would be a recommendation we would come to this board. Currently, the folks, if departments have sent them home, they're using their own accrual banks right now.
Okay.
Go ahead.
That's current status. So I'm just trying to figure out where we are today. So those employees who are sent home because they're non-essential, and I know that some employers are, for example, cutting their workforce in half, and half would come in this week and half would come in next week. So, it's kind of balanced out. So I don't know what we're doing here in the county for departments, but I assume there's been a lot of discussion in regards to options for department heads on how to get the job done. So that's what's happening currently. So then when we go to these the family medical leave, that's the one with 2/3 up to 12 weeks, which they can use credits for to supplement to make sure they get 100%. Is that correct? That's what we're talking about.
There's two things. There's the emergency paid sick leave.
80 hours.
Just the 80 hours.
Right.
And then once that's exhausted, if an individual still needs to be at home to care for a child because of daycare or school closures, then that kicks into that FMLA expansion that you're mentioning, which specifically is called the FMLA Public Health Emergency Leave.
So the 80 hours has to be expended first before it goes in Okay.
That's my understanding.
Okay.
All right. And Supervisor Wynn, the big difference is, as Madam Chair said, 80%, 80 hours, 100% of pay.
Right.
After those 80 hours, to take it to 12 weeks because they go concurrent, correct, Ms. Hopkins?
They go concurrent, so it'd be about 10 weeks if an employee hadn't already used FMLA this year.
And 2/3 of their salary.
Okay.
After the 80 hours.
Okay, so an employee who's, and it looks like maybe schools will be out the rest of the year. I mean, who knows when they're going to end. But and a parent has to stay home because they can't get childcare for their children. So that's one. So the last part of this is that we have a variety of options for our employees and for our department heads to get the job done. And when we go from the 80 hours to the 12 weeks or whatever happens to be, and then you talked about advancing credits up to 96 hours, which, as Supervisor Miller was obviously concerned about, is the consistency of that pay. Then they could use those extra 96 hours that they've been granted in advance to supplement the 2/3 to make sure they continue to get a full paycheck. I know we're not making that decision. I'm just talking hypothetically. So we have a lot of options. And again, as Supervisor Miller talked about, is that we have employees who are actually working, and they're not at home for whatever reason. And so, we do need to look at something to benefit them for their service and obviously having to be in the workplace. I did talk to Chris Woods earlier. And he's got a remarkable operation in regards to how they're handling it, which is one of the most visited county offices we have. And I give credit to him, and I know Fonze and Assessor Bestaritas and others who are looking at this whole process. I think we need to have a discussion so the department heads have the flexibility to decide within their own workplace how they're going to best service the public, but at the same time, really try to stick to this reduction as much as possible of human contact or exposure. So these are all things that we probably need to bring back and talk about in detail so that everybody understands, including our employees, which are concerned as to what the outcome is going to be. So again, thank you.
Thank you.
Yeah, and I want to piggyback on what Supervisor Wynn said. The folks that are being sent home, they're not home because they're unwilling to work. They're home because we've deemed them that they perform non-essential tasks and we're sending them home. If they're still willing and able to either work in another department, I say let's do it. Let's do as much as we can to keep them performing essential services and plug the gaps in the system. But once that's satisfied and we send them home, this is part of our responsibility as an employer to abide by the governor's order to send our non-essential employees home to help prevent the spread of this virus. It's not something they're deciding and it's not their fault. And I think as much as we are able, it's our job to figure out how to keep them and their families, their heads above water during this. And so that's what I would like to see come back to the board. And as much as we can use up all this other assistance from the federal government or from the state or wherever, let's use it up. But I would like our employees to know that that's the goal here at the county, is we're going to figure this out as much as we can as a team, but we're not going to just say, oh, well, that's the way the cookie crumbles. You need to go home and figure this out for your family.
Just quickly on the 2/3 issue, I did ask David Wetmore, a federal lobbyist, if there was any understanding as to why that was different. He said he didn't have any insights as to why, and that there's a lot of confusion about that particular section of the law, and that there might be some additional guidance or clarification in the DOL guidance that's coming out, Department of Labor guidance that's coming out. So I think there's a lot of confusion out there amongst counties. So that's what he had to say.
That seems to be the process. There's
provide you with that
order, there's a bill, there's something passed, and then there's massive confusion about it. And then over the next 48 hours, we get continued clarification. So thank you, Ms. Voorhees.
And Madam Chair, if I could add, I mean, we're talking about the county workforce, but generally FMLA did not apply to employees under 50. This new resolution does. So the employers basically with a tax credit are prepaying or are paying this sick leave where they might not have had that benefit before. So, I mean, it is a great expansion of FMLA to employer bases that were not eligible for it prior.
Great. Thank you. Okay. So Supervisor Villaputo, I'm sorry.
Thank you, Chair Miller. Chair Miller, I agree with everything you said, and I agree. You said you maybe wanted to come back. I think right now is the most critical time. I think we should probably vote on this now. I think 2 weeks to our next board meeting is too much. I think we should, like you said, on behalf of our employees, we're looking out for them. I think we should make a decision now that we're all together.
Well, I don't believe we can actually take action on specifics, but I'm going to look to County Council. But what I'm hoping is that we can get back some more detailed recommendations, and we will provide direction today to schedule another meeting. I agree, we aren't going to wait 2 weeks on this.
So to Supervisor Villaputo, to your question, so our employees are covered immediately with the 80 hours. So for the next for full-time employees who are non-essential, who are not at work, they are covered and receiving their full benefits for the next 2 weeks under the federal legislation. Okay. So they are covered.
Okay.
And I believe that Chair Miller was going to request that we have a meeting within a week, and that would be the goal, would be to come back before that so that there is no gap in time and we can address what the plan is going forward after those 80 hours expire.
Understood. Thank you.
Great. So what we need today is a motion to implement H.R. 6201 immediately. Is that correct, County Council? You want to give us a specific language?
That's correct. Implement H.R. 6201 and give direction, which I believe has already been done, to County Administrator to implement those provisions with regard to health care and first responders.
So move.
Second.
Okay, we have a motion and a second.
One clarification here.
Excuse me. Go ahead.
Mr. Miles, can you clarify what, when you say implement these procedures with regard to first responders, what exactly is that?
So the provision for both the 80 hours and the FMLA, expanded FMLA, there is a provision that allows the employer, in this case the county, to withhold those benefits from health care and first responder employees. And the recommendation has been to not completely cut those benefits off, but to say health care and county first responder employees, in order for you to take advantage of those benefits, you're going to have to go through the county's COVID clinics for the medical clearance.
All right, so that's what we're
Yes.
approving today. Okay, great, thank you.
And I apologize, I didn't catch the second. Who seconded that?
Right here. Thank you.
Supervisor Villapudua. So we have a motion and a second. Please cast your votes. That is adopted 5-0.
Madam Chair, our treasurer tax collector is in the audience. Would the board like him to come forward to share?
Yes, please. This is on the question from Supervisor Patty on what are the options, what is the status of delaying payment of property taxes.
Good afternoon, Chair Miller and members of the board. As stated by Mr. Miles, the property tax deadline is regulated by the state. So right now we are waiting for some information from the state this afternoon, actually. So as soon as I get some information, I'll update the board and also our website. Regarding what the county has control over is the relief of the penalties. At that time, I would assume that, again, we would be very reasonable to the individuals that are impacted by the virus and other items. I do want to make it clear that the Association of Tax Collectors aren't heartless, and they, again, the idea of not wanting to extend the deadline is really due to other agencies that rely on the funding. Also, if we were to extend the deadline right now, a majority of the mortgage companies are going to be making their impound payments. So if we extend the deadline or the delinquent date, they could possibly just withhold it until it's actually due. So those are some of the things that we're looking at. So.
Thank you. Supervisor Patty, you have a follow-up question?
Thank you, Madam Chair. I think you addressed it. So the penalty phase of it would be subjective and something that we could control.
Correct. And again, I would be very reasonable when it comes to it. I don't want to commit to anything because each case will be reviewed on a case-by-case basis.
Is that something you'll bring back to the board for consideration or something that you have the authority?
Something we have authority already.
Okay, great. Thank you.
Thank you.
Ponce, how about the interest? Can you share with the board?
Well,
What is the interest rate?
Yeah, the interest is, as it stands right now, if you don't make your payment by December 10th, by April 10th, 10% penalty will apply. Come June 30th, after that date, then the 1.5% delinquent penalty will apply on the amount. And again, if the state decides to extend the delinquent date a little further, which I would imagine that's what they're working on right now, then all that stuff wouldn't really be an issue.
Okay. Any other questions? Thank you. All right. We have two more discussion items. I'm going to suggest we take like a 5-minute, no more than 10-minute break. Let's say we come back here at 10 minutes to 1, just so we can stretch a little bit, and we will be right back. All righty? And we're going to move on to our next discussion item, which is from Environmental Health.
Good afternoon. No social distancing problems now.
Yeah, exactly.
So I have Casey Foley with Environmental Health, Interim Director. Good afternoon. Chair Miller, Supervisors, CAO Nino, and County Council Miles. I'm here to give a presentation on the micro enterprise home kitchen operations and an explanation basically of Bill AB 626 and 377, and I'm going to make a clarification that Supervisor Elliott asked for through Mark Miles, that I'm asking for the county to opt out, but really what I'm asking is for the county not to authorize, which is not to opt in. So throughout the presentation, I'll use the term opt out in lieu of not authorizing, because that's how the language is written in the Health and Safety Code, is the county may authorize. So here we are. So a micro-home enterprise home kitchen operation is operated from a private home. It's defined as a restricted food facility which has fewer requirements than a fully permitted restaurant. It's made for the preparation of preparing meals and serving meals and meal components. It's on-site. It's for on-site consumption, takeout and delivery, but of course, if we did authorize, it would not currently be for on-site consumption. It is not a catering operation. A catering operation requires the food be prepared in a commercial kitchen. It's not a cottage food operation because it's not authorized to serve potentially hazardous, cottage food are not authorized to serve potentially hazardous foods. And it's not a wholesale business. They're not authorized to prepare food and serve it, sell it to somebody else who can then sell it. I will read a little bit from the board letter just for a little bit more clarification. The changes to the California Retail Food Code allow for the sale of food from private homes, historically a prohibited activity. The foods that can be prepared under a micro-home enterprise home kitchen operation allow many potentially hazardous foods to be sold, unlike the existing cottage food operations, which allow non-potentially hazardous food preparations from home. There is a limit on the food that can be prepared. They can prepare 30 meals per day with a maximum of 60 individual meals per week. And they must have verifiable gross sales of no more than $50,000 annually. This is something that's difficult to enforce. Some foods are still banned, the extremely hazardous foods, which are smoking as a method of food preparation, curing foods, adding vinegar as food preparation, any sale of raw milk or sale of raw oysters. So one of the concerns for a micro-enterprise home kitchen operation is that Environmental Health, which is the enforcement agency in this county, may only conduct one annual inspection, and the inspection is by appointment only at these facilities, which are homes. An additional complaint inspection may be performed, but it also must be scheduled. An emergency inspection, defined as a limited inspection of a micro-enterprise home kitchen operation that poses a serious hazard or immediate threat to the public health, must also provide notice to the permit holder prior to inspection, and it adds to the extent it was reasonable. The inability to inspect these kitchens in operating condition inhibits the purpose of a complaint inspection, which is to determine issues contributing to any foodborne illness, which is the point of a food inspection program. So I wanted to go to the next slide, which are the professional organizations which are opposed to this law. They are the County Health Executives Association of America and Health Officers Association of California, in addition to Urban Counties of California and Rural County Representatives of California. And I have a letter which I failed to include in your packet. I apologize, when 626 first came out, so I do have it in the slides. And that's from those organizations explaining their concern about foodborne illness and the cost of investigating a foodborne outbreak. So CDC provided some statistics that from 2014 to 2017, there were 37 foodborne illness outbreaks, 1,374 illnesses, 261 hospitalizations, and 7 deaths. Those deaths were in the county adjacent to us, Contra Costa County. Microhome enterprise kitchen operations have exemptions. They're exempt from things that a fully permitted food facility has to do. So they don't have a separate hand washing sink, which is required in the kitchen and food preparation space, meaning they can prepare the food, raw chicken, and wash their hands at the same time, which is a great increases the possibility of cross-contamination. No commercial grade equipment or finishes are required. So a specific finish means it has to be easily cleanable surface. If it's not that, then bacteria can grow more easily, harder to clean. And then the equipment itself may not be the correct size to hold the food that is required to be stored at the proper temperature before it's served. And this is actually the reason of the outbreak in Contra Costa County. It was a person who was preparing food for turkey for Thanksgiving, and they didn't have the right refrigeration, so they just let the turkeys out and then took them to the facility, and the rest is not a good story. Next, no 3-compartment sinks for washing, rinsing, and sanitizing equipment and utensils. Again, that's another extra safeguard required for fully permitted food facilities to protect public health, to prevent cross-contamination. And then no thermometers for hot and cold holding equipment, and temperature control is really the main protection to prevent against foodborne illness. No testing equipment for sanitizer solutions, which means that there's a possibility the sanitation requirements may not be achieved. And unlike most laws passed, this law does not allow us to be more restrictive. You cannot pass additional ordinances or resolutions to be more restrictive for food safety. And as we heard today, you could normally pass more restrictive, you just can't be more lenient. So on that topic, forget I'm in control of this. The local cities that I surveyed on this topic were appropriately concerned about the zoning, building, planning, and fire issues associated with preparing and cooking food from a home without protections in place. They're afraid that there's going to be a greater possibility of fires because there are no requirements for specific venting, and you can actually, if this were allowed, if this were authorized, you're allowed to prepare these foods in an apartment building. So that even seems greater risk to everybody else in the apartment building. And then the fats, oils, and greases can go straight down the drain. You don't need a separator or anything to prohibit that, which you do in commercial facilities. And then the traffic itself, a big nuisance for the people living in the neighborhood. So that's what I heard from the local cities. So the second part of that is the governing body shall have full discretion, and that means the Senate Bill Assembly Bill 377 clarified that means if it disallows cities to opt out even if the county decided to authorize this program. So the cities don't have the option to say, well, we don't want it. So that's why they're asking us to not authorize it. So the current status of other environmental health jurisdictions in California, we have 32 that have opted out, which I'm going to rephrase and say really have not opted in at this point. 2 that have opted in. The first one, Riverside, is the author of the bill, so that makes sense that they would opt in. And then Imperial County just opted in December. And then I've heard that counties that are looking at opting in, there are 5. There's Los Angeles, Marin, Mendocino, Santa Barbara, and Solano. And then the city of Berkeley has their own health department, and they too are looking at opting in. Our cities in San Joaquin County, each one was contacted, and we've heard from each one, and there's a letter in your packet that asks the county to not authorize this program or opt out. So in conclusion, I mentioned this is going to be brief. I believe the county should opt out from microenterprise home kitchen operations due to the concerns of public health professionals because of their concern it likely increases foodborne illnesses and additional resources required to investigate those illnesses. We work closely with public health, and it would require both of our departments to investigate those. It allows potentially hazardous foods to be served with limited oversight by the regulatory agency. It's exempted from many public health and safety protections regarding equipment and operations. It limits local planning and zoning operations from regulating businesses in the home. All incorporated cities in San Joaquin County agree that San Joaquin County should opt out, and only 2 counties in California have opted in. Plus, I didn't mention in the presentation, but it's in the board letter that there are alternatives for community that exist that our community kitchens can be used as a low barrier entry to prepare food. One's in Lodi and one's in Stockton. And with that, I conclude my presentation and open for any questions.
Foley, any questions? No, not a public hearing. This is just a discussion and action. So, be looking for a motion to not authorize and or opt out, but
I would make that motion to not authorize and to opt out. So highly recommended to follow that
Second motion.
Okay, we have a motion and a second.
Okay, just to clarify now, we're already opted out. So
That's
the motion was to not opt in, right?
Yes.
Correct. To not authorize this program. San Joaquin County is.
Okay, great.
Yep. Good clarity. Thank you.
Yes. Okay, please cast your votes. That is approved, 5-0. Thank you, Ms. Foley.
Thank you.
Next up is a discussion item for action from Public Works. Mr. Balaji and Mr. Buckman.
Thank you.
Disinfect you a little bit here before you get ready.
Thank you so much.
Can you rub him down with one of those wipes?
Thank you, Madam Chair, members of the board, and thank you, Supervisor Hyatt. Because of you, I may have lunch today. Take home. Yeah. This is the item in front of you is regarding an appropriation increase for 4 of the special districts. This is very rare, actually. In the past, board has never seen it because we used to appropriate the entire fund balance, in the budget. And to have some accountability and transparency, we tightened up the process. As you know, we have over 100 special districts for which we put annual budgets. And I would say that, we're like bringing to you for appropriation increase only 4 of them, and that too because of emergencies that happened that necessitated that increase. So as you also know that you approve a special district budget each year, separately. And this budget is appropriated as part of our regular budget in June. And, we typically, prepare the budget and finalize it by March that, goes into action by the board in June. So we put in some modest contingency amounts into each of these special district budgets. Those contingencies, I know I asked Mr. Buckman that question yesterday. It's more of a science, more of an art than a science, actually, because they take into consideration how old the system is, what the probability of things to go wrong and fail, those kinds of stuff. There is no saying that's why it's a contingency. So we put those contingencies in, and at the same time, I'm a bad boss, actually, because when we look at that contingency, we want to make sure that we're not building too much contingency, in those things also. We tighten it up pretty good. And actually, our guys have done a phenomenal job that, this is very, very good that we only have 4 districts, and for the amounts that, they're asking, we're asking you today for your approval, and the reasons for it that you would see in a minute, they're very, very good, actually. So the 4 districts are CSA 12, Supervisor Wynn's favorite district, Thornton, $30,000 increase in appropriation, CSA 16, Park Country Estates, and CSA 44, Fair Oaks, that's Supervisor Elliott's favorite district, and the McCallum Acres Maintenance District, actually. So the CSA 12 provides water, storm drainage, and street lighting services to about 250 properties. We appropriated $229,000, which included a $30,000 contingency, and we're actually requesting an increase for $30,000 to finish the year, basically. So the reason for that is we had a 30% increase in the utility maintenance labor, about $25,000 that we spent from the contingency. That was because of the failure of a storm drain pump that caused backup and required additional cleaning and such. So, and also there was some customer service deal that we did not budget for, which is to clean out some of the weeds and stuff on the well side. So, and the most importantly, we had some permit cost increases, about 70% higher than previous year. So that cost us about $2,500. So those things reduced our contingency that we originally budgeted for. So we want to make sure that we had enough appropriations in the bank so we can continue to do the business and finish the year in positive. Then we have, the CSA 12 it had a negative fund balance for years, actually. And we actually had the rate increases approved in 2019. So good news is that we're climbing up. So, we're not, this additional appropriation, it puts a little bit of a setback in that, climbing up, but we will eventually recover within the 5-year period. The rate increase is already in place, approved, so that's good news for this. And we'll go to the CSA 16 Park Country Estates. We had a $225,000 roughly, approved budget, including a $50,000 contingency. And we estimate that, we would finish the year about around $224,000, which is very close to the appropriated budget. So we wanted to increase that contingency by $30,000. And then unanticipated expenses included removal of a sediment and buildup in water pipes due to the customers' complaints. And also we observed some water quality issues that resulted in that additional expense. So we, the CSA 44, it provides water service to zones E and G, Moral Manor Maintenance District for a total of 350 properties. We had a budgeted amount of $288,000 with a $70,000 contingency, and we expect that to go up to $355,000. This is because of a pump failure resulting in an alternative well to be used. And that alternative well, we keep them as a standby. This water level is too deep, so that means it requires extra pumping, resulted in a 42% increase in the electrical costs, about $55,000. And also, we still need to go fix the well that failed at about $10,000. So that constitutes a bulk of what happened unanticipated, resulting in us coming to you for increasing that contingency to finish the year. And we have a fund balance of $105,000, and water rate increase is needed for the CSA 44 Zone E and G Supervisor Elliott, this is different from the sewer rate increase. We already were contemplating on this thing, and the residents were aware of this need as well. And we posted this failure, the pump failure, and the increased amount that we had to draw from the contingency on our website. And we also had, if you recall, Supervisor Elliott, we had a discussion, one of your constituents called, asked for root cause analysis and such. So the customers are aware of this unanticipated thing that happened. So we will, you know, hopefully we get that increase and we will recover that fund balance within the next 5 to 6 years. McCalmy Acres Maintenance District provides water and storm drainage service to about 1,000 properties. And we budgeted about $335,000, including a $35,000 contingency. Now our estimated expenditures are supposed to be anticipated at $20,000 more than what we originally planned for. And this is also because of a well rehab that was unanticipated due to bacteria problems, required additional flushing, and that resulted in most of the costs on this particular district. And also we had unanticipated pump station repairs that resulted in about additional $30,000. So we do have the fund balance for this district to cover this extra contingency that we are seeking to appropriate right now. So Mr. Buckman, anything else? Would you like to brag or add? I could share my mic, but I won't.
I think you covered it pretty well, but I will point out that with the modest contingencies we budget, 4 out of 100 plus districts is a pretty good ratio.
Exactly. Any questions from the board? Supervisor Elliott.
Thank you, Chair. So just to be sure I understand, when we're talking about these total budget figures for the year, that's not their entire fund balance. That's just the amount that was projected a year ago to take them through the year.
That's exactly correct, Supervisor Elliott. Yeah.
Thank you. And I was pleased to see that on CSA 44 that you're already looking forward to the what if the rate increase doesn't pass and what sort of cost reduction measures will need to be implemented. And I'm confident that you will express that to the residents and make it clear that it's their CSA, not ours.
Supervisor Miller, very good point. I know this unanticipated expense is a bad thing, but in light of, when we go to the public, we can show them, look what happened. And these are the kind of reasons why you need to have a reserve in place to address that. So even in the disastrous thing that happened for us, there is a silver lining, for us to explain to the public why we need that rate increase.
Right. Yeah. Thank you. If there are no more questions, then I'm looking for a motion to approve, to authorize this increase in appropriations.
I'll make a motion to approve.
Second.
We have a motion and a second. Everybody, please cast your votes. That is approved 5-0. Thank you very much. Last thing before we go to closed session is Board of Supervisors comments or reports. Supervisor Patty?
Thank you. I'll say, I'm not speaking for any other board member, but I know that during these challenging times, every single person working in San Joaquin County has stepped up. They're doing what they have to do, even enduring some hardships and uncertainties. But I know I'm exceptionally proud of watching from our CAO's office to our many directors and the departments and the services and emergencies and all the protocols that are being taken place right now. I'm impressed, pleased, and grateful that the citizens of San Joaquin County have great, competent leadership and action being taken to protect them as best possible. So I appreciate all the efforts from those that work on behalf of San Joaquin County collectively.
Thank you. Anyone else? Supervisor Wynn?
I would probably echo Supervisor Patty's comments. I have talked to some department heads. I know we all have. And I think they're doing everything they can to keep the county in business and servicing the public. I look forward to our next meeting. I don't know. I hope we do it next week, next Tuesday, with some of the recommendations that you're going to come up with. And I think until we get some clarification down the road with either the state or federal government, we probably should meet on a weekly basis because things change so quickly. There's just a lot of issues that keep coming up that I think the board needs to weigh into. So appreciate my fellow supervisors and certainly their hard work in trying to get this resolved. And hopefully, there's some signals coming out of Washington that this may be sooner as opposed to later, but who knows? Still waiting for that spike. And that's one thing that, probably next week is get from Theo Cuplerson and the other hospitals. I know they're working on a plan to create as many beds as possible and equipment. And so it'd be nice to have a presentation as to what the hospitals are doing to prepare, because I keep hearing the spikes coming, and I hope we're ready for it.
I agree. I heard a comment yesterday on the news that I thought, for me at least, gave me the visual. When we look at any numbers today, what we're actually seeing is the status of about 2 weeks ago. And the way to visualize it is, it's sort of like the light from a star. It happened a long time ago, but it takes a while to get here. And so because of the incubation period of this virus, the numbers we see today is actually more in line with where things were 10 to 14 days ago. So we need to try and visualize that going forward. I'm also very impressed and very grateful for the folks at San Joaquin County. I try to explain to people who get impatient that, for a small business to respond, it's a small operation with very few employees, and they're able to be far more nimble. The larger a business or an organization or an entity is, the more like turning an ocean liner it is. It's a much wider turning radius, and it takes a little longer. It's far more complicated, the operations. And so I appreciate everyone's diligence in working through this so that we can put out a consistent message. I know it's very helpful to all of our cities when the county can be very clear in our messaging. So I appreciate especially the work of OES and our public health, all of our healthcare professionals, our pre-hospital professionals, as we're referring to them now. Very grateful. So we are going to adjourn to closed session. I'm going to turn to County Council. Do you?
Just a moment.
Oh, I'm sorry, Supervisor Elliott.
Yes. Thank you, Chair. I too have participated in various conference calls that have gone on here about the COVID-19 crisis here, and this has included not only our EOC but our MAC and then CSAC initiated conferences as well. So I too am very impressed with just the professionalism and the degree of hard work that everybody is exhibiting to try to meet all of these challenges here. I would like to add just one piece of information here. I got this at dated, the timestamp was 8:58. Oh, that was last night. Okay, 8:58. That was just before our meeting. But it had to do with the recent governor's emergency declaration, emergency order, executive order, and the interpretation that has been generally agreed upon concerning that effect on 37 Act counties and their ability to waive reinstatement and work hour limitations for annuitants. They're interpreting that, at least as of this communication, to say that executive order extended those waiver flexibility allowances to the 37 Act counties as well. So that would include us. So Please look into that, County Council. I think we should be able to assume those things can apply to us as well.
Forward that.
Sure.
Thank you.
Thank you. Anyone else? Supervisor Villapudua.
Thank you, Chair Miller. Just want to recognize maybe all the first responders, like the firemen who are, I understand they're in quarantine right now, and maybe all the nurses who are working overtime, the doctors, and, law enforcement who are risking everything they have right now. I mean, this disease is serious, and they're on the front line, and I really want to really thank them and appreciate what they do. Thank you.
Thank you. County Council?
Board will meet in closed session on the items listed on the agenda. There are no announcements expected coming out of closed session.
All right, then in that case, we will be seeing everybody back here a week from today.
So on that would be, I'll just add, pursuant to Government Code 54956, Chair's calling a special meeting for
March 31st.
March 31st.
March 31st.
9 a.m.?
Yes. Thank you, everyone. We'll do one first. I'll take it back.
Oh, can I go to the bathroom?